What's up, everybody? Javy Martinez here. Really excited to be joining y'all for day 2 of Glorium Technologies healthcare. How healthcare is changing the industry. Really excited about today's speakers. We have 7 amazing speakers that will be joining us today. Ryan, our first speaker, is here waiting in the green room in the back, and I'm going to bring him up and introduce him. I'm really excited for Ryan to be joining us today. And ultimately, thank you to everyone that's joining us. So, Ryan, how's it going today?
Doing well. How are you doing?
Doing well. Thank you so much for joining us.
Thanks.
Can you hear me okay?
Yeah, I'm good. Can you hear me okay?
It's a little staticky. I can hear you, but it's just a little bit staticky, but I think we should be all right. Let's see. Okay. So Ryan's going to be talking about usability is your most important feature. And Ryan, I'll let you, introduce yourself, take over the floor. And if you want to maybe leave 5 or 10 minutes at the end for Q&A for the audience.
For sure. No problem.
Awesome. Mike is yours.
Just going to see if I can fix some of these audio issues. Okay, I'm just going to share my screen and cross my fingers this works. Nope. Not quite. There we go. Okay, great. Thanks, everyone. It's great to be here. My name's Ryan Whitham. I'm the CEO of PaperCurve. We are based in Toronto, Canada, and we are an enterprise SaaS company serving pharma, biotech, and medical devices. And we're really the premier software solution provider in the space. We help with all types of content needs. So we have a specific process, the medical, legal, regulatory review, which that's how we got started. And then from there, we've really expanded into a lot of different areas in the business, sales enablement teams, medical science liaisons, contract lifecycle, all things that revolve around people and process and documents and collaboration, and then really making sure we had specific solutions for life sciences, built on the solution. And then from there, we've really last year we built a whole AI solution. So really to better understand the text and content in documents, help with making associations to content and relationships, understand content, and make connections that would otherwise be really manual in the space. So that's a really high-level overview about our solution. Let's see if I can. So, what we really wanted to do was, one thing that was really important about PaperCurve and the solution that we have is we wanted to make sure that we had really good team adoption. A lot of solutions in the space, that we saw in our competitors, we heard a lot of sort of horror stories of people not using the software, very expensive solutions. You have turnover in the space, and that's part of what I want to talk to all of you today. So the problem with enterprise software is that people don't use it. Not just in health and health tech, but all over the space, there's actually 60% of licenses are used. So that means 40% of these software licenses are unused. Which is a pretty staggering figure considering the millions of dollars that are spent. So even a small company, less than 1,000 people, they're spending, upwards of $15 million a year on software licenses. So it's a pretty staggering figure to understand when you think about it, that this much money is just being wasted. And so, we not only sought to make sure that we didn't want to have that problem with our own software, strictly first of all, we want to bring people value, but second of all, we we thought it was important for our own survival. If it came to light that our software wasn't being used, we don't want to lose clients over it. They say, actually, no one's really using this. So we, from the beginning, made sure that we were tracking it and monitoring and making sure people are getting value through a number of tactics, which I'll get into later. But let's talk about why. Why is so much software that when you go to work, your software is so bad, whereas at home and your personal life on your phone, apps get better and better and easier to use. I'll start with a really sort of extreme example. So what we see is important systems and processes are really design failures. So this screenshot is a screen for the alerts that go to smartphones for the state of Hawaii. And this is what somebody's job was to manage this. And so obviously a lot of work, I'm sure, went into redundancy and backups and standard operating procedures, but nobody put a lot of work into the usability, given this screen. And so what happened was, you can see some of the messages are about landslides or amber alerts, things that you might be familiar with, but there was one that is for a missile strike, and a ballistic missile threat went out to millions of people on the entire island of Hawaii, causing a bit of panic. Some messages from mom came in saying, honey, take shelter. And, it was a big mistake. And so, immediately like, oh, what, this is a human failure, but it's not. It's really a software failure. You can't expect people to, to be successful if the two options they're given, just the only difference is drill. So you're one click away from sort of disaster. So obviously this is an extreme example, and I would hope commercial products don't have interfaces that are this bad, but it does sort of illustrate the point that we don't prioritize usability and experience and adoption when it comes to software, when it comes to work, the same way that we do in consumer apps. And it was a problem. Another way that I can kind of illustrate the point was, this is a survey from OpenText, and it was in our world of the software. They were saying, what's your most important feature? This is where I got the title for this talk. And right at the top was ease of use, user adoption. It wasn't search, it wasn't processes, it wasn't analytics, it was user adoption. So what that tells me is that people actually know there's a problem. The people that make these decisions, the business owners, they know that there's a huge problem with using these things. So then it gets into like, is usability really a feature? I mean, we've got this list of features. What makes ease of use really a feature, and what does that really even mean? So let's look at, why does adoption fail in the first place? Number one is just poor usability. I've got some random screenshots here of enterprise software, and we just say, look, usability doesn't matter when you go to work, and that just can't be true. We've got all of these things that require training, and say, don't worry, we're just going to send you to this one-day training, or take all these webinars, or there's all this documentation. The way I would look at this and frame it is, would you do the same? Would Facebook do the same thing? Would Facebook say, to use our app, you need to take this course, or all of that? So if they had done, if they had that sort of criteria, they would fail. So they need to make sure that people my parents' age can use it without any training. And let's be honest, it's actually a fairly complex app, especially now. There's a lot of different functions, a lot of features, and nobody trained the billions of people to use the Facebook app. And so we can't make these excuses that, oh well, for work it's different, you need to have all this training. And you need to, take this course. So it's just not realistic. So I think that's one. And so to combat this, what we see is managers to the rescue. It's the carrot and the stick. So they say, no problem. You don't want to use it. We're gonna mandate it. And everybody needs to use this software, and this is how you use it. And that's how we'll get our adoption up. And don't get me wrong. Like at times, PaperCurve has benefited from this. When it comes from the top, saying, look, PaperCurve is the standard for this, and you're gonna have to use it. Obviously, we see our adoption go pretty high, but you can't rely on that, especially as a business, and to the other people on this call with businesses. If you rely on that, it takes a long time to get that level of traction and to get that buy-in from stakeholders. So relying on managers to force it down, it's not really a good strategy for success. The other thing that we see is why does it fail is login fatigue. So a survey, a recent survey from a company called Zillow, that the average, on average, there's 217 SaaS applications in a 1,000 person company or less. So really, it just tells us that the number of applications has exploded, and so to sign into yet another application, to remember the password, and all of that, even if you had SSO, there is a lot of login fatigue, and that has come over time as more and more SaaS applications do more niche things rather than behemoths. That has come as a larger shift in enterprises where the power is going from IT departments to more teams who can, pay for things on their own and leave IT out of it, which is our goal as well. Obviously we're happy to talk to IT when it comes to our security and other things, but when it comes to who's making the business case for the application and who's going to actually be using it, typically it's the leader of that team. It's someone up there in regulatory or compliance or legal or possibly operations. It's not IT people making those decisions. So that has led to so many more applications being in these companies. Really a staggering number. So why does adoption fail? It's too many logins. Turnover. So there, not just recently, not just in the pandemic world, but even before that, turnover was really increasing. We're seeing it getting even worse. From our own data, we can see that 25% of employees turn over in the last year, which when we say to our clients, you realize that we can give them the stats because we can see it in the user deactivations. You realize how many of your employees have turned over last year. It's a pretty high number. They say no, it's not that high. Then we can give them the data, and they're blown away. And so when you have that kind of turnover, it means that if you went to this huge lift to get someone trained up in using it and seeing the value and understanding maybe the more nuanced parts of your app, if you suddenly lose that employee, you have to start at zero. You're starting at the beginning, and at times we've had companies where there's a lot of turnover, there's a lot of people leaving all at once, and then you lose your key stakeholders that really understand the nuances. And so we're seeing our customer success teams almost starting at zero in some companies because of turnover. And so if you don't have an application that's easy to get into, to understand the value, to get value out of the application, right away and immediately, you're not going to see high adoption. You're not. And so, the turnover is forcing us even more to focus on, ease of use and adoption. So let's talk about how to fix it. So one of the things that we do is test with users. So there's a couple ways that we can do this. Often, our customer success team, who they're awesome. They really built deep and strong relationships with our clients, particularly key stakeholders, people that use the application a lot. If we are working on something new, we'll make sure we get out early and walk them through it, get them to test it, get their feedback. Is it clear? Do they understand the value? It's really important that we get out to them early. The other way you can approach it, especially if you don't have a lot of clients, is you can test with strangers. So you can pay people. When we started the company, I would go on LinkedIn and just find the people that are the right role for our application, and I would say, I'll give you $50, $100, or whatever, for half an hour of your time, and get them hands-on with the prototype, get them clicking through the flow. So we would do this with Zoom. It's pretty low tech. We'd record it so that we had it, and it's amazing what you would uncover. When you got that feedback from users, you'd really understand where the weak points in your application were. Often, it wasn't that your designer wasn't awesome. It was often wording. Maybe wording is unclear. It could be the title. It could be helper text. It could be they get stuck. So to really make sure that your interface is, clear, that the user flow is straightforward, and that the value is obvious, from the beginning. And if it's not, they're going to tell you. So there's a couple practical ways you can do this. So like I said, if you have friendly people that you can call up and get their time. If you have to pay them, do that. But if you don't, there's platforms out there that will play sort of matchmaker for you. I use Playbook UX, which you can basically, they have a huge pool of tens of thousands or possibly hundreds of thousands of users who are willing to get paid a small amount of money for their time, and they will help recruit users, and they can walk through a series of steps of tasks they need to complete, and then they'll sort of speak out loud as they do that work. So you'll say, okay, that was easy, or that wasn't totally obvious. You can see where people get lost. Also, usertesting.com. Those usertesting.com, I've used at larger organizations. It's fairly expensive, but good if you have a bigger operation. So testing with users. This is something that you can do with features that are brand new and yet to come out. Or if you feel like there are failures in your current application, you can always just take your current app and see how people go through the process and see where the weak points are. So test with users. Sip of water. Measure it. So you need to track the things that matter in your application to know if it's getting better or worse. So for us, there's a lot. We are a document, video, content collaboration platform. So the types of things that we track are things like uploads, things like comments. It's where our customers are getting value out of the platform, and we need to make sure that those things are trending up or trending down. Otherwise, we know we have a problem. We use a number of tools. We use this BI tools that connect directly to our databases. We use Mixpanel is a great analytics platform. There are others, so I'm not here to plug one or the other, but that's what works for us. So that's one thing to measure. So you're really measuring user interactions, things they do, to see what's working and what's not. And then the great thing about that is you've got a baseline, and then if you make a change to the application, that change could be to the application or promoting it or doing other things to see if you can move the needle. You see if that metric goes up, which is really, really critical. The other thing you can measure is we use Net Promoter Score. So it's a survey that goes out to users, a very simple survey. On a scale of 1 to 10, would you recommend PaperCurve to a friend? We have it pop up in app. We try it on email. And not only do you get that score, but where we actually really see the greatest value is some of the comments that we get. about how certain things or maybe we could improve. It's good to get that numerical score to see is that number trending up or down or flat. But there's a gold mine of qualitative data in that measurement. Talk to customers. So, like I said before, customer success is a critical part of our company at PaperCurve, and they set up recurring meetings with call them power users. Some people don't like that term. I've grown to accept it, but it's the people that really use your application a lot, and those monthly meetings, we really learn a lot around what's working and what's not. And so on the right of the slide, this is a Kanban board in Jira. That's our customer success board. And each one of these tickets are feedback from clients. So if they say, I'm having a problem with this, or it'd be really great if I could have bold and italic in my comments, that gets tracked and it gets discussed on a bi-weekly meeting, so we don't lose track of it. So it's great to talk to customers, but if you don't have a process to capture it and manage it, you might as well not bother. So this is another critical part to making sure that your experience is always getting better. This helps us with our prioritization. Often we get focused on the big features where sometimes there's feedback around something smaller or nuance that we could slip in. We always want to make sure we get done. So logging that feedback in a visible place for the team and making sure there's a ritual to cover it and to discuss it and make sure those improvements are getting action is critical. Now, one thing I'll say is we don't action every comment or feedback from clients. If something seems maybe at odds with other feedback or we're unsure, we do have a monitor column where we make sure it's captured, but we say we're not going to go ahead and just fix that. We're not going to fix everything that a client may say, but we might either get more information or see if other people have similar feedback over time. One word of caution is don't let every little piece of feedback drive your roadmap on your application. Use it yourself. Probably heard the term eat your own dog food. And we actually for a long time, we weren't really using it internally. We were using other applications. Then we realized what if we aren't using it ourselves, how can we expect our clients to use it and love it and not do some of these tasks in other applications. So as soon as we started using it ourselves, we really got to understand maybe some of the feedback a lot better. If people talked about a pain point in the application, we actually felt it. Or if something is raised, you could say, oh, you know what, I've had a similar concern with that as well. So using it yourself, eating your own dog food, you really better understand the strengths and weaknesses of your own application. The details matter. So as applications grow, it gets easy to ignore edge cases or even some of the more delightful parts of the application. And I think when we first started, we were in a big hurry. But things like loading states, things like small animations, some of the nuances that make things better. They do matter, and they do add to an overall feeling that your application is a great one, and that PaperCurve is great to use. It's everything from small interactions, hover states. Every little bit counts. The photo I have on the screen here is of the SpaceX Dragon, Crew Dragon capsule. And I was watching the first crew mission, and I noticed that on all these touchscreens, these astronauts were touching it, and there were these beautiful animations from things moving from side to side. They had little 3D models that turned. All of the software that was built for these astronauts It was beautifully done. And what struck me is, this was obviously the first mission. This was 2 astronauts. This interface was made for 2 people. And the care that went into making software for 2 people, especially things that weren't just functional, they were also, aesthetic and, made it sort of a pleasure to use. A lot of care went into it. And then even since then, there have only, by my count, been 24 astronauts that have used this interface in space. And so, especially if you're starting out, making sure, if only a few users are using that feature, or only a few users are actually on your platform, making sure those details are well thought out. So that means, loading states, empty states, error states, not just the straight through, happy path, making sure that it's really well thought out and well conceived. Here's another shot of it, so you can just see, the beautiful interface that these astronauts get to use up in space. I saw a comparison to the shuttle. It was just all switches. That's it. So final thoughts. So software can only be valuable if people actually use it. So if your application, if only 60% of the licenses you sold that client are being used, that's going to be a problem. Eventually, someone's going to figure it out and realize they're not getting the value of that application. And it's not enough to just hire the best designers and have a pretty interface. It's a grind from top to bottom. It involves all teams, not just designers. It's the designers to make it easy to use. It's the wording that is clear and concise, that people get it. It's your customer success and your marketing, making sure people know about these features. We ourselves, like me personally, involved with getting one feature adopted, more than it is. It's something that, we have a feature called compare versions. It's a simple, comparison, and it highlights the differences. And in my mind, the adoption rate was not high enough. So I'm, getting out there, pounding the pavement, making sure users know about it and know, understand the value and how to get there. So it doesn't work if you just build the software and nobody uses it. You need to listen to your customers. You need to measure how the application is performing, and you need to iterate. Typically, you don't get everything right the first time, and so that feature, that part of your application, is only going to get better, once you've iterated and taken the data you've heard from customers, you've seen the data, and you've made changes to iterate it better. And then the last thing is software really needs to disappear. This image is of a voice-controlled, appliance where, hey Siri, hey Google, that's the ultimate in software disappears. It's not an interface. It's easy to use. My grandparents can use it. And so that's where things are going. It's not just voice control, but in applications that, on smartphones and other things. If you just don't think about the software, just think about what you're trying to do and the goal and the task that you're doing, that's how you're going to lead to bringing value to customers and making sure that they want to use the application every day. That's it. Thanks a lot for your time. It's really been and open up to any questions. Hey, Javy.
Thank you for that, Ryan. That was awesome. I definitely have a fair share of questions, but we'll see if the audience does have any first. So you're in Toronto right now? Is that where y'all are based out of?
Yeah, we're in Toronto, Canada. Yes. Yeah, I will say we are a bit spread out across Canada. We have people in different provinces as well, but most of us are in Toronto. Yes.
That's amazing. So for me, while we wait for some questions to come in, as far as software and stuff, the usability is a key factor for me. When I look into software, even though I help run an accelerator here in Dallas. So it's a two-part question. What can customers do to kind of, I think for me, I like to figure it out on my own. So offering, self-serving and like kind of do it yourself, do it with you, or do it for you type of customer support, because everyone, just learns and applies technology differently. So what is your recommendation, or, what do you think customers should be doing to communicate that with the companies? And in exchange, what can companies be doing more or differently with customers when it comes to like onboarding and activating them?
Sure, great question. So definitely when we get a new customer, we see someone's joined, our customer success will reach out and say, hey, we saw you just joined, or especially with a new customer overall, like, we do, free unlimited training. That's part of our core values. We don't, charge extra for that because we want people to get the value, right? So we offer, training, and then we make sure that there's maybe different tiers. So if you're sort of a light user, you only need this little corner of the application. That's a very, short 15 minutes, type of thing. If you're managing users, or you're really setting up, more complex things, you're setting up workflows and libraries, the more complex parts, that's, a little more. They're the key stakeholder, and we'll spend, whatever it takes. Often we're taking their SOP and translating it. But we offer, like, that's a baseline. So there's training. We also have live chat. So in the top right corner of our application, all the time, you click chat, it'll come in, and we have processes in the company that, if somebody doesn't answer, it goes down the line till somebody is there. It'll pop on my phone personally. So if it's like 11 o'clock at night, or some of my other partners, somebody will respond. We obviously, we obviously are there 9 to 5, but we really strive to really answer whenever somebody can. Also we have customers from all over the world, so with time zones issues, it may be the middle of the night, so we try to do our best. But yeah, live chat really helps. That's another. We have marketing that goes out, so we have product update emails that go out, that sort of highlight our new features and the types of things that we do. And yeah, I would say that's sort of the three things that we really do. But one thing I will say is you can't always rely on somebody taking that training meeting. That's why it's, a lot of this was you can't rely on somebody taking that meeting, because we see lots of users. They're like, maybe they're like you, right? Like, I'm more of a self-serve guy. I don't really want to do the training. I just want to poke around and try it out. So you have to make sure that it's a bit of a crutch to rely on training completely. It has to work on its own, without any training. It has to be obvious. We just do that to make sure that, for those people that like to learn that way, that's available to them. But there's always going to be different people that like to learn in different ways. So.
Awesome. Thank you for that. That was great. While we wait, there's no questions. We do have a little bit of extra time since we did finish early. Where can people find you? Where can they connect with you, online or offline?
So papercurve.com is our website, and you can find me on LinkedIn. You know what? I think I have my first slide had my info. But no, I didn't.
I can get with the mods and we can share it, but they could probably just find you on LinkedIn. Are you on LinkedIn, Twitter? What's your platform of choice?
LinkedIn is our number one. We do have Twitter, so we're at Papercurve, and then my email's here, ryan.whitham@papercurve.com, if you want to shoot me a note. So I'm always available.
Awesome. So last question that I got for you, if it's okay, what is your prediction for 2023? What is a prediction that you have for 2023 with healthcare, IT, and just kind of some of the things that you are seeing in your field?
So yeah, in my field, I think the macro thing that we'll continue to see in the pandemic, what we saw is the power move. I did touch on this move from IT departments to individual, divisions, teams to make their software choices. I think there's good and bad to that. I think it's good for companies like PaperCurve because we're typically the incumbent. We're trying to go up against, a big giant player, a big behemoth in the industry. Whereas, it's very relationship based if you're those big incumbent players. But for us, we want to compete on the value we bring. And so the shift from decision makers who get software from IT to go to the departments is one that will continue. And I don't have the exact stat, but it did move, significantly over the last year or two, and I expect that trend to continue. I think the other trend I would say is that AI machine learning, which we do a lot of, and we do a number of different things. We have a number of different features that do different things in the application. We'll move from sort of like theoretical or buzzwords to actually being used, as a default more and more, and not sort of a gold star feature that's sort of nice to have, or a bit of a buzzword. You're really starting to see the practical application come down. The cost is coming down. It's really part of the default tool set. And so I think that if you're a challenger in the space, it's an opportunity because you can build these tools a lot faster and easier and cheaper than you could have 3, 4, 5 years ago. And so I think it being part of the default part of your application will be critical. I think what comes along with that is that your interface is different. The end I talked about the voice control, speakers that we all have in our homes, but this is that type of an interface. It changes your user interface on a desktop application or a phone application. So for us, we're getting recommendations surfaced, rather than having to search. So it's very sort of web 1.0, web 2.0 to search for what you're looking for. It's something different and better and probably more accurate to say, hey, here's I think this is what you're looking for. Based on this, we think you're looking for this, and then having that human, confirm that selection is correct. So, whether it's recommendations or it's translation, whether it's classifying, things into different groups, all of these types of machine learning and AI will become, really the default and really challenge the incumbents to innovate or die.
Yeah, no, I think it's really interesting. A lot of people have talked, yesterday's about AI and how it's being used in their companies. And I think it's really interesting because a lot of people are looking, people that are not utilizing AI right now, or maybe don't even have to, don't realize that AI is not really there to replace your job. It's just to make you smarter, more efficient, right? Eliminate more of that human error in order for you to, either save time, money. So I think it's really interesting what AI is doing. And, especially in healthcare, which is that could be the difference between, and this is extreme, but like life and death, like in making decisions at a more rapid pace and accelerated. Now you don't need to take in all this data and put it in a warehouse and find it. You can find ways to expedite that process. So that's just I have very little knowledge in AI, but from what I know, it's really there to make you more efficient. AI doesn't have emotion, so it can't correlate like a human being yet, at least, so maybe those decisions should be left for humans, but at least it can recommend, like you said, and advise you on the best routes that you can take.
Well, you make a good point about particularly in health, right? There's a real reluctance to say, let the machines take over. So, and that could be anything. It could be, are you really going to trust AI to, identify, cancer in an imaging? Or in my world, we've got a lot of compliance people. Are you really going to trust the AI to make the decision? And it's like, well, no, I don't think that's not where we are yet. Right now, it's AI assisted, so it's not AI making the decision. So what we're going to still continue to see, I think, for quite a while, is AI assisted, saying, I probably found the right thing. You can have a human confirm, or also making sure that a human doesn't miss it. And so, it is a huge difference to folks in their jobs in all the different areas of health. But that reluctance to have AI make the decision, I think, will continue for quite some time.
Yeah, I agree. Yesterday, one of the speakers, Dr. Michelle, she has, I think it's IVF is what they're working on, but they're using AI, and the AI is helping with the imaging to detect. I thought it was extremely fascinating to detect, the good embryos faster, right, and be able to kind of, match up the good ones so people don't have to go through the process of failure, when trying to get pregnant. So I thought that was really cool. And obviously, healthcare is not something that's going away anytime soon. And it's probably one of the biggest, I think, industries that's lacking a little bit on innovation. A lot of opportunity, not only just in IT, but in other, sectors within eye care. So thank you so much for joining us. I really appreciate your time. Any last parting words before we let you go?
No, I think that's about it. Thanks so much for having me. It's great to be here. And yeah, you can catch me by email or LinkedIn. Thank you. Thanks for having me.
Sounds good. Thank you, Ryan. Thanks for joining us. Have a great day.
You too.
Bye. Awesome. What's going on, guys? So I'm going to be bringing up our next speaker, Brian Russon. He is the co-founder and executive officer of Patient Genie. How's it going, Brian?
Good. How are you, Javy?
I'm doing well. Thank you so much for joining us.
Of course. Great to be on.
So you were going to be speaking today about matching with the best care privately. So I will let you take the floor. You have about 45 minutes. If you want to maybe leave 5-10-ish minutes, hopefully maybe our audience is a little bit more awake this time around than this first speaker. So the floor is yours. Thanks, Brian.
Excellent. Thank you. Appreciate it. So good morning. Grateful for the opportunity this morning to meet with everybody, talk about Patient Genie and what we're doing relative to matching consumers with the right provider. So I'm going to simply share a screen here, hopefully, as long as the tech works. And hopefully that's working. Okay, excellent. All right, so when we think about Patient Genie, and maybe a little bit of background here, is looking at consumers and how they interact with the healthcare system. So prior to starting Patient Genie, my co-founders and I had founded a telehealth company that we sold to a much larger telehealth company. And one of the continuing messages that we got as part of that conversation and those conversations with those executive teams was, hey, we've built all this energy, we've built these front doors, we've built these applications, but the one area where we still struggle is where consumers are out searching for healthcare and able to expose and find our front doors or our connecting points. The understanding being there that those organizations have spent a lot of time and resource in building those front door applications and really struggle with capturing those consumers at the point of search. And so as we look at Patient Genie and what we've built there, what we did is really kind of iterate around couple of different modalities of delivery, whether that be, do we deliver via app, do we deliver via an extension? And where we ultimately ended up was a concept around rebuilding the entire search experience relative to healthcare. So what we did is we built a search engine that's specific for healthcare and made it completely private, completely secure. So we'll dig a little bit deeper into that here shortly. Ultimately, we all understand the problem. We all understand what it's like to interact with the healthcare system today. And say you move to a new region of the country or down the street and you need to find a new provider. Let's say your provider's retiring and you need to find a new provider. The typical modality for that is you'll go to Google, you'll search, you'll ask friends in your Facebook groups, you'll ask neighbors about who the best provider is. You'll get a bunch of recommendations. You'll go do a bunch of research, determine if they're in your network or not in your network. Are they available to schedule me? Do I have to call to schedule? Can I do online scheduling, etc.? This is a clunky user experience, clunky consumer experience, and not used to what we're what we're used to in relatively other markets. So what we've looked at doing is saying, hey, we've got this problem where it's extremely difficult not only to find the right provider, but to match with the provider, to find the right content in real time that's relevant to me or the condition that I might be facing. So what we've done with Patient Genie is build an AI-driven healthcare navigation solution that helps those consumers navigate through the complexities of provider search. So ultimately taking a qualified patient to the provider's front door, utilizing our patented algorithms and methods. So how that works and why that works and why that's important is because we know that about 77% of all online health inquiries start at a search engine. So when we look at individuals or consumers looking for healthcare for a new diagnosis, looking for information around a new diagnosis. Maybe they just don't feel good and they want to understand what's going on. Maybe they want to find a new doctor. Maybe they get diagnosed with something and they're looking for a specialist. Maybe they're looking for a second opinion. People go to search to find that information. The second bullet there is around, slide jump there. The second bullet there is around understanding that people and the general populace really only has about a 12% literacy rate relative to navigating the healthcare system. I'm in healthcare. I've been in healthcare for 25 years. I still struggle navigating the healthcare system. And it's because there's a lot of incumbents. There's a lot of new ventures. There's a lot of relationships in this space. And most organizations have numerous vendors that serve different purposes inside of either the health system or the health plan, in engaging their patients, engaging their members, engaging their consumers. One of the things that we know is that only about 2% of appointments are scheduled online. This was a pre-pandemic number in transparency. So we anticipate that that number's probably grown since the pandemic. But what's more important is that 68% of patients say they're more likely to choose their medical provider decision based on the ability to offer appointments online, to schedule appointments online, to manage those appointments online, that they'll shift their entire buying decision based around that one simple kind of process as part of the workflow. The other big piece that's of open concern to us right now is the projected physician shortfall in 2033 or by 2033. We already feel the pressure of the shortfall. Anytime we need to schedule in with a new specialist, schedule in with a new provider, engage anyone in the healthcare system, there's a significant wait relative to when we're able to see those physicians for whatever the case might be. We anticipate today at least a shortage of about 21 to 55,000 providers by 2033, and that the non-primary care specialties is even more significant than that. That being said, we have to find a better way to engage the system, to take the resources that we have in the providers that are currently deploying care and spread that out. Now, what we do know is navigating healthcare is not easy. We're all consumers of healthcare. If you interact with the US system at all, this is what a typical consumer experience looks like when you're trying to find care for whatever reason. Whether that be, I need to search my health insurance company to find out if I have coverage. I need to find content about a condition that I might be facing. Maybe I want to do online scheduling. Maybe I want to do telehealth and that virtual connection. Maybe I got diagnosed with something or I need a procedure and I want to find out the price transparency about that to ensure that I'm getting the best quality deal. Maybe I want to have Uber Health or Lyft Health to transport me to my different appointments, or maybe transport an aging parent to those appointments. I interact with 3 or 4 different health systems for a variety of different health reasons. And as a result, I end up managing myself in 4 or 5 different patient portals that aren't connected. There's no consistency between those portals. So every time I go into each individual portal, I have to update and share my same information that I've already input into the other systems. So when we look at that consumer experience, that's not rich and that's not effective at all. And so what we've done with Patient Genie is said, look, there's a great stream of products in that middleware space. Organizations that are building great products inside of their niche, inside of the specifics of what they've done. You take a look at ZocDoc, for example. ZocDoc's done a phenomenal job around building online scheduling. They've got 50,000 providers that are in their network that allow for real-time scheduling of appointments virtually. You look at companies like Kith and Kin on the PHR side and really kind of building a repository for consumers to store their health information and other information that's relevant to them in a cloud-based environment. You look at companies like Wheel and Ellipsis and Jasper, eVisit, Tiger Connect. And the slides and the brands on this slide are, you know, phenomenal companies in what they do. The problem is that there's no one really concatenating those experiences for the consumer. And that's what we're doing with Patient Genie. We've built that search engine that allows you to search for any symptom, procedure, doctor, etc., in one modality and one experience for the consumer. And then through APIs and back office connections, we go build the connectivity pieces that are necessary for that consumer to have one seamless experience with the healthcare system. So how do we work and what does that look like? So today in Patient Genie, which is live, we're in beta right now, that's live online at patientgenie.com. We have 11.5 million keywords where you can, again, search by that symptom, search by condition, search by a procedure, search by a provider or organization name. We use AI to start to layer in understandable text in that search bar. We don't want to pop 8 million different results or potential results in that search bar. And so what we do is we try to refine that search down through AI to bring back the most relevant search criteria. And as you can see on the right-hand side of that kind of search box, those grayed out items are where we're actually refining that even deeper. Is this a symptom? Is this a provider? Is this a specialty or a focus area that you're looking for? So we can help kind of build that best search. And then what we do in the case where we have patients or consumers come in and request or have questions around a specific condition or a symptom, we take them through a very simple symptom checker. So in this case, we take them through 800 potential conditions. That's growing. So currently we have one vendor in this space that allows us to capture about 800 conditions from those inputs, mostly in the kind of ED/ER space. We are going to layer in additional behavioral health capabilities, dermatology capabilities, etc., where we can use text or voice or images to do not a diagnosis per se, but based on those inputs, have an understanding of what a potential diagnosis might look like. And the reason why we do that is so that when we get to the end of that search result, we can come up with that kind of expected diagnoses. In this case, we've grabbed common headache. And what you can see here is that validated educational content where we're scraping the web. We are a web crawling search engine. The only difference is that as you search and go through this process, we don't have any cookies, we don't have any trackers, we don't keep track of this. If I search for a common headache in Patient Genie today, and then I go to Instagram or Facebook later today, I'm not going to see ads resulting from a common headache. We don't sell those ads. It's not our monetization schedule. So you can trust that the searches that you do, and especially the healthcare related searches that you do in Patient Genie, stay there. We're not going to sell it. We don't even track it. We don't even capture that information. The only information we capture today as part of our search experience is age, sex, and location, and we only keep that for 30 minutes to maintain a consistent search experience. Once that's done, it's gone, and we don't know anything else after that. So once we have that kind of diagnosis, sorry, I get off on little tangents here. Once we get that diagnosis or that pre-diagnosis in place, we can start to pull back this specific content, which you can kind of see captured in red. And we have a handful of relationships where we pull back that educational content. We'll continue to kind of build that capability out. We've got some really exciting partnerships in the works right now that are focused on specific specialties and specific conditions where they're pulling the most relevant and the most time-sensitive content back into our platform. The second thing that we do is we match you with the right provider. So the way that we have done this is we went back and created a profile for all 5.5 million providers in the US. We looked at their claims data. We looked at their clinical data. We tried to understand virtually how they operate as a practice. So I have a bad shoulder, right? It's an old climbing and snowboarding issue. I fight with it all the time. A few years ago, I had problems with like really constant dislocations. So I was looking for a good, solid shoulder surgeon. I went to my health plan. I searched for an orthopedic surgeon. I got back a list of orthopedic surgeons. And then it was my responsibility to call through that list and find out, hey, are you a hip surgeon? Are you a knee surgeon? Do you do shoulders? Are you only doing shoulders, et cetera? So I had to do all that legwork as a consumer to find out, A, if that provider actually did the surgeries that I was looking for, and B, if that provider took my health plan, if that provider could see me anytime soon. Again, a clunky user experience. And so in this case, what we've done with that 5.5 million provider profiles is said, hey, look, we understand what this physician looks like. We understand what that practice looks like. We understand the procedures that they do inside of that clinic. And then we can take that information and we can map that or match that back to a consumer that's looking for a specific condition or has come through with a certain kind of pre-diagnoses. And then we can display this list of providers that match or best match that consumer in that search. So we have 4 patents that protect this kind of algorithmic approach to how we match providers with patients on those inputs in preparation for a visit. What's interesting and exciting about what we're building here is that, let's say that I found Dr. Westholder here, which we're looking at on the screen. I've contacted his office. I can see here that these boxes underneath his name, those grayed out boxes, I don't have the capability, at least today, in the platform to schedule or to do a telehealth visit or a secure message or maybe Uber if I want to Uber to his office. So in that case, I may say, hey, I really want to do online scheduling. So in Patient Genie, I would click that Find Similar Providers button there in the purple underneath that profile. And what we've done is we've extracted all the data for Dr. Westholder, and then we go search and scrape across our provider database to find other providers that look like Dr. Westholder and bring those into that search criterion. Then I can further refine that results to say I'm looking for a provider like Dr. Westholder, takes my insurance, but that allows for online scheduling. And in that case, what would happen is that online scheduling button would light up. In this case, we've obviously switched doctors. And now you can see that that scheduling button is lit up. Litten's not a word, lights up. So now I can actually book an appointment directly with this provider through the same application layer where I've searched for a condition, found a provider, and now I can schedule directly with that provider. Obviously, as you can see here, we use ZocDoc as our kind of connected partner around online scheduling. One of the first organizations that we worked with and engaging around some of these capabilities. We'll continue to build out those capabilities around telehealth, additional online scheduling, messaging, etc. And why is that important today? When we look at this ecosystem, when we look at, and I'm going to bounce back a couple of slides. Again, back to this slide. When we look at this ecosystem of partners that we're building, the capability for a consumer to go through that experience, and now that you've seen it and kind of can correlate that, go through that experience and say, you know, when I use Patient Genie, I can schedule directly with my provider. I can schedule a telehealth visit. I can receive the care I need in a single seamless relationship or consumer experience. And that's a lot richer than having to go to my health plan or going to the health system and navigating through all these front doors that are put in place today. For those of you familiar with healthcare, you know the back office work in EHRs and PHRs is a heavy lift. And there's a lot of organizations doing great work like OneUp and those guys that are doing great work in trying to take some of that data and bring that forward. And so what we're really doing is building that layer between the consumer and the industry to create that seamless experience. The secondary piece of that is we've talked a lot about kind of the consumer and how the consumer engages with Patient Genie, but let's talk about how a provider engages with Patient Genie. So we have a subscription-based model similar to LinkedIn or HealthGrades or other organizations like that, where a provider can come in and say, hey, this is me, this is my practice, this is my profile that you have about me as a provider, and I want to focus on a couple of new areas in my practice. So we leverage SEO to enable those providers to be able to capture what we would deem as kind of like social media buzzworthy terms. So in this case, what you can see here is we're looking at bionic knee. So I've got 3 teenage daughters. They're infatuated with TikTok. It's disturbing on one level, but they receive a lot of information on TikTok. I saw one analytic that said, you know, they had done a poll with preteens 18 to 24, and 90% of those polled in that window said that they received some medical information from their social media. As a father of daughters, that's disturbing on a number of levels. So we want to make sure whatever content's getting out there is, validated content. We've talked about that, but I digress. Here we go. So back to bionic knees. So let's say, there's a TikTok about, hey, I just got my bionic knee and it's awesome. Well, in the industry, we know that there's no such thing as a procedure, bionic knee. What we do know is that there is a procedure that's the replacement of a knee joint or whatever the case might be. And we know the CPT relative for that. So what a provider could do is they could come in and say, hey, look, I've heard about this bionic knee in the market, but I know that that's just a simple knee replacement. And so what I'm going to do is I'm going to go in there and I'm going to say that I do bionic knees as part of my treatment or procedure practice, but link it to the associative CPT code. By linking it to the associative CPT code, we then, through our algorithms, can go back and extrapolate out of the data that, yes, you're right, this provider actually does bionic knees, or by definition, by true definition, a 27447. And as a result, they're going to drive higher on our search criteria, both with us and with traditional search engines like Google or Bing, because we're capturing that and we're indexing and profiling all that information. So when we look at SEO for providers, here's a great example of how they can really kind of move their business or their clinic or their practice to the next level and capitalize on a lot of those kind of what I would deem as kind of social media buzz terms by still leveraging kind of the capabilities inside of their practice. As you can see kind of grayed in the back screen there, some additional details about what a provider can add. Obviously, because we're not an advertising-based revenue model, there's no way for a provider to buy their way to the top of our search results, but there's absolutely a way for a provider to data their way to the top of our search results. And so in this case, those are those gray bars you see on the left-hand side, where a provider can add additional information about themselves, help us stay consistent with them and their practice, add their telehealth or secure messaging vendors and landing pages so that those purple buttons that we looked at a minute ago light up, and give them the capability to really be exposed, if you will, as people are way out of that point of search. So at the beginning of my presentation, I talked about one of the struggles that we saw with health system partners that we were working with was that exposure piece. And this is what we've built around that exposure connectivity, either for an individual practice or clinician to come in and own their profile, or for a large organization, a large health system, a large ACO, a large provider organization to come in and say, I'm going to do this on behalf, I'm going to provide this data on behalf of all of my providers inside of my system. So we deploy in a couple of different ways. The first way, and I'll start actually on the opposite side of the slide, on the second side, which is direct to consumer or B2B2C, where we actually deploy patientgenie.com online. That could be a white labeled experience. We also have a true D2C and beta, which is what you can see at patientgenie.com. And then on the left-hand side is what you see as what we affectionately refer to as our embedded model or our B2B model, where organizations, other health organizations, other tech companies, employers, providers, health systems, health plans can take our search bar that has all that underlying AI, ML capability, algorithmic capability, and just drop that directly inside of their existing digital assets. So we're not trying to rebuild any tech. We're not trying to rebuild any of that hard work that's already been done. We're not trying to replace any of the vendors they have in place around their specific niche solutions that they have inside their organization. What we're instead trying to do is bring that top of mind. Now, if I were Austin General Hospital in this case, and I've got that find a doctor provider link on my site, what we do in that search result space is that we build a walled garden around the results. So if I land at Austin General and I search for a provider, I'm only going to see providers inside of the Austin General system. If I'm at a health plan, for example, and I hit that search bar, I'm only going to see providers that are contracted underneath that health plan, as opposed to the right side in direct to consumer, where you're going to see everything until you establish those filters as a consumer down to the next level. So when we look across the ecosystem, horizontally across the ecosystem of delivery mechanisms and healthcare organizations that are working with consumers, working with members, these are the kind of value statements that we start to look at relative to those specific organizations. So if I'm a provider, obviously the ability to claim and manage my profile, the ability to create and deploy a seamless experience for my consumers and my patients. and then really kind of having all that real-time data in one place being utilized for the growth of my practice. If I'm a health system, it's around digital care navigation. We've all seen the scores for health systems and their scores around consumer efficiency and consumer capability, usability, et cetera. And that's a struggle point for a lot of those large organizations. Access to care, being able to build new networks, so to bring in a referral tool or to find new providers for those health systems, et cetera. And then obviously health systems spend a lot of money on branding, and really to kind of help strengthen and grow that brand is a key piece for what we're doing with Patient Genie relative to health systems. On the employer and plan side, again, care navigation is key, being able to find providers faster in a more efficient way, and then obviously providing access to care and brand as well. And that's the end of the deck. So I want to open it up for question and answer.
Find my mouse. How's it going? Thank you.
Good. Yeah, it's good.
So we have a few questions. Well, it looks like 2 questions. So the first one being in regards to some of the things that you spoke about. Are these challenges to access healthcare mostly based in the U.S. healthcare system, or is that global?
No, the challengers are consistent globally, right? I mean, the Canadian system's a little bit different, but there's still access issues in the Canadian system. The UK system's a little bit different, but there's still access issues in the NHS, right? The Saudi system, we're talking to a couple of organizations in Saudi, with a very strong Ministry of Health, but still have accessibility and connectivity issues there as well. So the challenges aren't necessarily specific to the US. It does have some functions in the US that are different than other parts of the world, for sure. We have a completely different system, but the fundamentals are the same. And so when we look at deployment of Patient Genie, and I'll kind of lead into the kind of next question around the US being unique. It is unique in a sense, but there's consistency globally. So when we look at a global deployment of Patient Genie, we're already looking at implementations in other countries. We can deploy currently in about 14 languages. And so we plan to expand that. I mean, for us, all we really need to do, because of how we've built the product, the real core for us is being able to look at the provider mix inside of inside of a country. So if we were to go deploy in the UK, for example, right, all the infrastructure and tech is the same. We just need to go work with NHS to bring back that provider data so that we can start to build those provider profiles. And once we have those provider profiles built, then our matching algorithm can pick up and go. So for us, that's the roadblock, if you will, when we look at global development, is really kind of understanding the provider dynamic and the provider mix, and then going forward. Fortunately, I-10 and most of the coding is somewhat kind of similar across the globe.
Okay. Interesting. Yeah, I'm not too familiar with a lot of the coding and all that. Healthcare is definitely something that's one of the fields I haven't familiarized myself. I help run an pre-seed accelerator here in Dallas. So we don't have a lot of health tech. So I know it's definitely, like I was mentioning to the last speaker, it's definitely one of those areas where it's like, it's an industry that's not going to be going anywhere, but ultimately, like, we're so far behind from a technology standpoint. And like, I think what I've starting to realize based on like all the conversations that the speakers are having with our audience is that it seems like everything's very siloed in the healthcare system. And, we need more of like those softwares or things that are bringing things together. Right. Cause, like the previous speaker was mentioning, the usability for me, like I use so many different softwares. I wish there's one that can do like most of them, because I have to log in and out. And it's just such a pain in the butt, So there's another part to this question. He said, Akash said, if so, how is the U.S. healthcare system unique in creating such challenges which other developed countries do not have?
Yeah, I mean, if we had a single payer system, I think the U.S. is unique in the sense that we don't have a single payer system. We have a multi-payer system, right? And so that creates obviously dynamic changes or differences in how consumers interact with the system, how the system interacts with patients and consumers. I think one of the other kind of key pieces that we've seen around uniqueness in the U.S. is just the ecosystem of vendors as well. There's a lot of companies in health tech. I just got done at another conference last night in Vegas, the health conference, which is, I think there was 7,000 people the first time I went to the health conference. There was like 400 people. So, that's grown substantially. A lot of big companies, a lot of great startups. And as accelerators scattered around the country, really kind of fueling health tech. And so I think the U.S. is dynamically unique, in which creates a petri dish, if you will, of us really be able to test the best tech to deploy globally.
Amazing. So it doesn't look we have any more questions, but I have a few for you. So first off, where can people find you, offline? Are you on Twitter, LinkedIn, email?
Yeah. So LinkedIn for Patient Genie for sure. LinkedIn's our usual and best way to communicate. Then obviously directly brian@patientgenie.com is the best way to find me.
Amazing. So we do have a little bit of time. The others, we finished a little bit early. As far as, we're almost done with 2022. It's been a crazy, last 12 to 18 months. What is your prediction for 2023 in your space?
Yeah, it's going to be interesting. It's been interesting to watch the evolution in this space. If we go pre-pandemic, and I came from the telehealth world. We were building telehealth platforms, 2015, 2016. We obviously have evolved through the pandemic and really adopting telehealth. We saw huge spikes, around the utilization of that due to the quarantines. And now we're starting to see a leveling off of those spikes, where people, want to be in the office. They want to engage with their provider. They want that face-to-face interaction, but they also want the convenience and usability of telehealth and online scheduling and online scripts, et cetera, et cetera. And I think what we'll continue to see is the balance between, virtual health and brick and mortar health. And there's never a full replacement, right? Quarantine was it was chaos, right? From a telehealth perspective, we were going from 4,000 sessions a quarter to 4 million sessions a quarter in the span of about 60 days. So, for us, having to scale an organization that quickly was not in the roadmap anywhere. We were on this long tail of telehealth development and regulation and legislation and everything else. And then all of a sudden, the world shuts down. And so, barring any kind of big issues like that, I think it'll be interesting in 2023 to watch evolution move. I think a horizontal marketplace like what we're talking about with Patient Genie, I think we'll see more of those horizontal marketplaces start, and we'll continue to kind of drive that. I think that's the one big piece that's missing is that consumer kind of play. Obviously, that's why we made the bet we made.
Yeah, no, absolutely. So we did have another question come in, and then I have a question about something you just said, but I'll wait on mine. So Akash asked again, what's the future of global standardization for health taxonomy frameworks such as ICD-10, CPT, CDT?
Yeah, I wish I knew. I would love to have some kind of globalized standardization. I think we're getting there. I think as we continue, fortunately or unfortunately, the planet's a small place. I think our providers are mostly trained in the same organizations. We have a lot of providers that are trained in medical schools here in the US and Canada and Australia and the UK, and then deployed, kind of globally. And I think that the innovation around tech, the innovation around telehealth and the capability for a provider to be in London doing surgery on someone in Istanbul and being, kind of assisted by somebody in New York at the same time will continue to kind of marginalize and shrink healthcare in a sense. And I think as that continues to progress, the need for taxonomy to be consistent and standardized across all of healthcare globally and not be kind of language dependent or country dependent will drive that. So I think we're on a trajectory when it comes to global standardization, just because the dynamics of how healthcare and the modality of how healthcare is delivered is changing so rapidly that it'll force the system to get there. I saw a presentation by Oracle this week where they said, Cerner's, they're the largest EMR in the world. And I think as you look at the deployment of that and other organizations like that are going to force standardization globally, will drive that factor down.
Interesting. So with that, and unless there's more questions that come in, my question for you is, with technology changing so fast and with the healthcare space being such a regulated, industry, from a security and privacy standpoint, how should companies in a way be preparing themselves, right? Because I think what I'm starting to realize is companies are not trying to just like to grow and scale quickly. They're more like trying to squeeze all the juice out of what they have right now, right? And get creative about how they, either, can this would sound wrong, like marginalize or just make more profit, right, from their current customers in creative ways. It's going to be mutually beneficial, right? So, with government and with all these laws, like how should companies be prepping, especially if you're using AI, and other technologies that could essentially be considered a hazard, in my opinion, when it comes to decision making.
Yeah, I mean, the dual-sided sword of AI and diagnoses in healthcare is that we'll never replace the human element in healthcare, right? So this isn't like fintech where, we can fully replace, and I don't know what's going on with my lighting, so, I'm not intentionally
No worries.
purpose over here. We're not fully kind of intentionally in a place like fintech where you could replace the entire automation of healthcare, virtually. That doesn't exist in healthcare. There is an element of healthcare that requires touch and feel, obviously, right? And so, I think for us, and as we look at companies, I think there will be a pretty significant consolidation in the space over the course of the next decade or so, where you'll really see kind of the top companies kind of boil to the top, right? And they'll swallow up a bunch of the small guys and really become kind of really industry behemoths, leveraging AI to operationalize a lot of the mundane or non-human capital required activities in healthcare. Healthcare is still 40% inefficient if you look at the statistics. And so there is a lot of white space when we talk about inefficiency in healthcare, just operationally, right? You can remove 40% of the cost of healthcare operationally with AI. And so there's still a lot of white space there that doesn't have anything to do with delivery and has everything to do with administration.
Interesting. That's quite a number, for an industry that gets billions and billions of dollars poured into it. So, well, thank you so much for your time, Brian. It's been a pleasure speaking with you, and thank you for the awesome presentation. Any last parting words before we let you go?
Go use Patient Genie. We're in beta. Give us some feedback. We'd love it.
Awesome. So everyone check out Patient Genie. Thank you, Brian. I hope you have a great day.
Thanks, everybody.
Awesome. Well, thanks for those who participated with the questions. I'm going to bring up our next speaker, Dr. Amit Sawant. He is the CEO of Somatics. I hope I pronounced that right. And Somatics. Thank you. How's it going today?
It's going great. Excited to be here.
Awesome. Well, I really appreciate you taking time to join us today, and really excited to hear your talk about smart devices and smart clothing, the future of health monitoring. I'm wearing my Whoop right now, so I'm a big fan of I call it human performance optimization. At least for me, But floor is yours. I'll let you take over. If you want to maybe leave 5 or 10 minutes at the end for a Q&A.
Sounds good.
Awesome.
Yeah, so let me share my screen here. Okay, so let me know when you guys can see my screen.
We can see your screen.
Okay, great. Yeah, so let's get started. Thanks for the introduction. Excited to be here to talk to you all today. So the topic for today is smart devices and smart clothing, the future of health monitoring. So I'm the Chief Operating Officer here at Somatics, been with the company for almost 2 years, and been in the health tech space, really excited at the intersection of healthcare and technology. So I also have a background in high tech, been a startup advisor for a few years, acted as an adjunct faculty for courses in product management. So with that, let's get started. So the flow of the presentation is that I'm going to talk a little bit about the motivation. What are the factors that are leading towards this smart devices, smart homes, smart clothing? Then talk a little bit about connected health, how everything is sort of coming together. Then talk a little bit about Somatics' Safe Being platform, because we have built truly a great AI-powered remote patient monitoring platform. Would love to give you a little bit of an overview around what that platform is about. Then talk a little bit about smart homes, how the paradigm of connected health comes into play, and especially with all of the changes that are happening from a technological perspective, how that's a, truly not something that's 10 to 15 years away, but it's there right now. And then finally, I'll summarize with some conclusions and what are the things that I'm excited about going in the next few years. Okay, so over the past decade or so, wearable technology, especially wristbands, watches, rings, have gained immense popularity. And also it has, and I'm starting to see the movement from wearables that are used purely from an athletic perspective, athletic purpose, to how is it that it can be used to improve a patient's health. And that's something that really excites me. And here are some stats. 1 in 4 Americans own a smartwatch or a fitness tracker. So you can see that the adoption of these wearables, especially the smartwatches, wristbands, is increasing drastically, especially with the Fitbits of the world, the Apple Watches of the world, the Whoops of the world, right? So truly, wearables have entered the mainstream. And some of the factors that have really enabled that is the improvement in the internet speeds, the technology around it, the adoption of cloud, like pushing your data into the cloud, the security aspects in the cloud. I think these have really gone a long way in that mainstream adoption. Smartphones, like the form factors, the cameras, the amount of sensors that are being packed onto the smartphones have drastically increased. 5G, just the cellular speeds, the Wi-Fi speeds have drastically increased. So the processing of the data that gets collected through these wearables, either using the Wi-Fi technology or BLE technology, and doing the number crunching, whether it's on the device itself or after the data is being pushed onto the cloud, and done in real time, has really increased. And that's the value that it is providing to the users of these wristbands, of these smartwatches. The battery life on them has drastically increased as well. So that really improves the use of these devices and the use cases that they are being used for, whether it's in a healthcare setting, in a hospital setting, that has really enabled. And then also the adoption of business models around SaaS, whether it's B2C or B2B. I think the adoption of these business models have really opened up from a business perspective around revenue streams for these wearable devices. And so there's also this talk about this quantified self-movement, right? So we are collecting a whole lot of data continuously, passively, using the sensors that are on-built onto these, whether it's the cellular phones or the smart bands, right? And sort of the collection of the data means, okay, now I'm seeing a whole lot of data around what's happening with me, whether it's related to activities of daily living, and then sort of what do I do with that data, right? Then comes the aspect of AI ML, adaptive machine learning, where it really learns the user and compares that data against, okay, what are the thresholds for a person with good health or someone with a deteriorating health. So based upon the data that gets collected, you can identify trends and patterns. And then that finally leads to better outcomes, right? So now that you have the data, you have analyzed it, identified the trends and patterns, what is it that you do next? And that's something that I'm really excited about, to see where do we take this, that is moving from an athletic option to a clinical imperative, right? Some of you may be aware of this, aspects around connected health, right? So here's a pictorial representation as to how is it that we can use the patches, the socks, shoes, wearable devices, the rings, the smart shirts, and the vest. So just to give you a couple of examples here, is that with the shoe itself, like you have the odometer embedded on it, so you can get a better sense of your steps. How is the balance of your feet? Whether are you putting your feet, appropriately or not, or are you prone to injury? So all of these can, the data that gets collected can really improve with your balance, right? So that you can avoid being injured. So this can be very useful for athletes as well as for like people like you and me as well, right? Then smart shirts, right? So it detects your posture, your heart rate, your respiration patterns. So let's say if your posture is poor, then through the data that gets collected, these smart clothings, especially the vest and the smart shirt, have can provide audio feedback as well as haptic vibrations through which you can improve your posture. So you collect the data, process it real time, and then based on the feedback that you get, you can correct your posture. So, and then if you're doing that over a period of time, so you can see a drastic improvement in your posture, right? So this is how I think all of the things can truly come together and lead towards a person having a better life. And that's something I'm truly excited about. So here's another example around wearable health electronics. So this is an article I read a while ago, published at The Economist, and I really like the aspect around detect a disease before it develops, right? Through these wearable devices, whether it's the earphones, the headphones, the sweatbands, whether it's the glucose monitor, whether it's the chest strap, smart clothing that we talked about in the previous slide, the Aura ring, the wristband, where there are these bunch of sensors that are packed into these small form factors, whether you talk about the rings or the wristbands, right? Sensors such as accelerometer, gyroscope, barometer, skin temperature, then PPG sensors that include heart rate, blood oxygen saturation. So just imagine that through these sensors, you are collecting a plethora of data around different types of health indicators. And then all of these come together to establish a pattern around what is happening with you or whoever is wearing these wearables, right? Then now the next step is, okay, great, you're collecting a whole lot of data continuously, passively through these wearables. So now this is where the interactions between the users and the doctors come into play, where I'm seeing a lot of adoption, a lot of positivity from the healthcare providers, physicians, and nurses as well, in being open to looking at the data that's being collected through these wearables, so that you can identify the deviations in certain metrics, certain health metrics for a patient, so that they can identify the development of a disease before it truly happens. You can see those early signs, right? I'm seeing that shift in the healthcare providers having that open-mindedness to look at the variables. And what has enabled that is the accuracy of the data, because we're using AI/ML, predictive analytics, to provide certain clinical insights. And in order for the healthcare providers to truly adopt that, you want to make sure that the sensitivity and specificity of your algorithms, the accuracy of the data is high enough so that there is that high level of confidence with the healthcare providers. Right? And this can truly result in big changes in the prevention of chronic diseases, such as heart diseases, diabetes. It's, as I said, it's great to see the transition from wearables being mainly used by athletes to the majority of the population. Okay, so let me transition and zoom a little bit into what we do at Somatics. So we are a health tech startup. We believe in the power of innovating AI technologies to provide insights that empower people to thrive in their health and wellness. So our tagline is insights that empower. So we track users' activities of daily living using novel gesture-based detection. So imagine I'm wearing a wristband, and through my gestures, I'm making a gesture of, let's say, drinking water. So that entire sequence of me picking up a cup, rotating it, like putting the water in my mouth, and like putting the cup down. So this entire sequence of steps is the identification that, okay, somebody did drink some liquid, right? So we can also detect smoking and a bunch of other things I'll talk about in the next few slides. But through the variables itself, we detect a whole lot of patterns. And then based on that, the collection of the data, we provide alerts, reminders, notifications to the users directly or to the healthcare providers of those patients if they are in a nursing home or in a hospital setting. So the platform consists of 4 components. The first one is the caregiver dashboard. So just to take a quick step back, so we are in a B2B SaaS environment where our customers are healthcare providers. So the nurses, the physicians across the care continuum, starting from independent living to assisted living to semi-assisted living, and also outpatients in hospitals. And we have also seen quite a bit of traction with rehab centers as well. Okay, so I talked about the dashboard. So this is where you enter the user information, and you can see a whole lot of charts and graphs based on the analytics that we provide around the data that we collect, the AI/ML algorithms that we apply on top of the data. And then based on that, we provide predictive analytics. Is a person at a risk of UTI, pressure sore risk, hospital readmission, fall risk, right? And then we also have a bunch of apps, user apps, where the user can go onto the app and look at their data as to how is it that they are doing, the number of steps, how much did they sleep, not only the quantity of sleep, but also the quality of sleep as well. Like there are these phases of sleeps. So how is it that the user slept, right? And then there's a caretaker app. Usually the nurses, the caregivers are always on the go, and they're managing a number of patients, maybe 10 to 15 patients in a particular shift. So if they have the caretaker app and they get the alerts and reminders, notifications for a certain subset of patients, so that they can prioritize that and go and look after that patient, so that this not only increases their effectiveness of providing care to their patients, but also uh, we have seen based on our studies that it also increases the empathy that they have for their patients. And then everything is predicated on the smart band. So we have built our own smart band. Um, we can also use our platform on top of some of the commercially available smart bands. We decided to build our own smart band because the feedback that we received from our users was that the battery needs to last 3 to 6 days. It needs to be cost effective. So that was one of the reasons why we decided to build our own smart band. It uses commercially available sensors, but we wanted to make sure that it has that high battery life, because most of the commercially available smart bands, we see that the battery life is around 1 day, 1.5 day, maybe max 2 days. Okay. So here are a few things that we monitor. To our knowledge, we feel like our smart bands do a whole lot than some of the commercially available smart bands. So we can not only detect simple things that other smart bands do, like walking, sleeping, but we can also detect forward falling. Apple Watch does forward falling, but we can not only detect forward falls, but also backward falls, sideways falls, falls from a wheelchair. One of our biggest competitive advantage is drinking. We can not only detect that somebody is drinking, but we can also quantify as to how much liquid intake did the person have. And this is all based upon our patented gesture-based detection technology, that is the detection of the motion of drinking and the conversion of sips to milliliters of liquid intake. One of the other feature that we are working towards is medication intake. This is something that we are very excited about. In fact, we are partnering with Roche Pharmaceuticals, where they have a program called Innovation in Dementia, and they want this capability where, especially for like people with dementia, it's hard for them to self-report whether they have taken some medication or not. So let's take the example that a user needed to take some medication at 12 p.m., but they forgot to take it. So our band, what it would do is that it would detect, oh, you know what, this person was supposed to take some medication at 12 p.m., but I didn't detect that gesture of somebody putting a pill in their hand, putting it in their mouth, having liquid or no liquid after that. But we didn't detect that sequence of somebody taking some medication. So then, and we have done that passively without any intervention, either from the nurse, caretaker, or the patient himself or herself. So now once we detect that somebody didn't take their medication, we can send them reminders every 15 minutes so that they can go ahead and take their pills. Now, smoking. In fact, we started the company Somatics with our smoking cessation product. So where we can not only detect the motion of smoking, but we can also calibrate it down to the accuracy level of how many puffs of cigarette did somebody inhale. Then we also calibrate all of the activities of daily living. In our next generation smart band, which just we released about a month ago, it also has an optical PPG sensor. So now we can get additional vitals such as heart rate, SpO2, skin temperature. And then we collect all of this data continuously and passively, and then apply machine learning, adaptive machine learning for that particular user, and provide clinical insights such as UTI risk. Now you may wonder, okay, so how is it that we do UTI risk analysis purely through a wearable? So the data points that we correlate to identify whether a person is at a risk of UTI is their hydration levels, like with the drinking detection part. Then how many times is this person waking up at night and probably going to the bathroom? So the amount of time that they are waking up. their activity levels. Are they more inactive during the day versus night? What is their sleeping patterns? How many times are they waking up? So correlating all of these, after correlating all of these factors, we sort of build the risk profile for a particular user, and then identify whether is this person is at a risk of UTI. So similarly, we do pressure sore risk analysis. So let's say if a patient uh, um, sleeps for a certain stretch of time and doesn't move around after 2 to 3 hours, then that particular patient is at a risk of having like pressure sore. So now, once we identify this risk, we send out notifications through the dashboard, through the caretaker apps, to the nurses and the caretakers, so that they can go and prioritize who they look after and go and take care of those patients. So with our technology, everything is passive. We are continuously collecting the data. There is no need to install any camera, sensors, beamers in the rooms where the user or the patient is. So everything is done, as I said, passively. So there is no intervention needed either from the patient or by their caregivers. It works both indoors as well as outdoors. And here's one of the three broad categories of things that we monitor. Real-time emergencies. A person has fallen, like the fall detection part, wandering part, they left their... The only thing that active thing, I guess, that our smart band has is one button. So if a user needs some help or there's some emergency, then they can press that button. Also, the emergency can be triggered automatically. They don't need to press anything, but if they need help, they can press the button, and then it triggers a signal either to the family member or to the caregiver, so that they can come and help the patient. Clinical insights, I talked about the hydration, the nighttime walking, the irregularities in the patterns, and then the predictive analytics part. I talked about the UTI risk, fall risk, and pressure sore risk. Okay, so here are some charts and graphs. I won't go into the details, but here you can see on the top left, it's a breakdown of your sleep. What's your daytime sleep versus nighttime sleep? How many times have you woken up throughout the night? And also, what's your sleep quality score? So we use a peer-reviewed scale, Pittsburgh Scale Index, which goes from 0 to 100, and then we rate each sleep session. So you can see over a period of days or weeks, you can identify a pattern. And if there's a deteriorating pattern for the quality of sleep, then that's where the nurse and the caregiver can have an intervention and see what's happening with this patient. So at the bottom left, you see a heat map, which shows the activity levels, at what hours of the day either a person has fallen or has liquid intake. Here you can't see the blue cups, but that's what it's indicating. Then on the extreme right, you'll see the configuration tab, which shows what are the settings that could be turned on or off based upon what are the events, notifications, reminders that can be set for a particular patient, so that the nurse and the caretaker can triage that. So as you can see here, our platform is very dynamic in terms of the amount of data that it provides to the user, family member, and caregivers, but also sort of the robustness in the platform to cater towards different use cases. And here's a slide that basically shows the workflow. I know it's a very busy graphic here, but here all I want to showcase here is that everything starts with the smart band. Then with the smart band detects the gestures. Then it sends that data that is detected through these sensors, either through Bluetooth, then onto the phone, and then from the phone it pushes to the cloud, or through Wi-Fi directly from the band onto the cloud. And in the cloud is where deep number crunching happens, mapping with our AI/ML algorithms happens, and then based on the identification of the patterns, the risk analysis, then also the clinical insights, all of that then gets pushed on to the dashboards and onto the various apps that we have on our platform. Okay, so now let's switch gears and talk a little bit about some of the other smart wearables that are out in the market. So smart socks. Now this is becoming a part of everyday life for some of the people. So even here, the form factor of the sensors has drastically increased, that now it can be embedded into the sock, right? And then through that, you're collecting a whole lot of data, once again, continuously and passively. So now what this helps us do, as stated in the slide, is that you can do step counting, the speed with which you're walking or running, your calorie intake, your altitude, because there's also a barometer sensor in there which accurately calibrates your altitude. Then distance tracking, cadence. How is it that your feet is landing on the floor, on the ground? And then based on that, it can provide haptic feedback, either through vibrations, and enable people to improve their cadence. So that, and then if you keep doing that over a period of time, it's going to avoid somebody having injuries just because of how they are landing their feet, right? So I can see use cases not only just for athletes to improve that and avoid injuries, but also for normal people, for common people who are not athletes, right? So this is great. Then there are these smart yoga pants, which can provide a private yoga experience to somebody who is not very experienced in yoga and wants to get into yoga to further improve their health. They can use something like these smart yoga pants. Once again, there are these accelerometer, gyroscopes, various sensors that are embedded into these yoga pants, which collect a whole lot of data and can provide real-time feedback, so that as you're going through the yoga session, you can improve your posture and thereby get the true feel of doing a yoga session. And this is also where then you don't need to have an instructor watching after every single step, but it's just through these smart yoga pants you can teach yourself yoga. So which I find just fascinating. Then I just recently heard about Gatorade coming up with this GX smart water bottle. So the components of these water bottle is, of course, the bottle, then the smart cap, which has a bunch of sensors, as well as some LEDs that light up, and then a sweat patch that goes around with this particular water bottle. So what you could do, I guess mainly it's catered towards the athletes right now, but I don't see why it cannot be used by other people as well. So there's this app. You wear this sweat patch, and when based on the data that it's sending, it identifies levels where the hydration is lower, and then it triggers that signal onto the water bottle so that the water bottle lights up, and indicates that you as the user should take sort of hydrate yourself, take more liquid. So I can easily see a collaboration between GatorX and the way we Somatics' safe being platform does the drinking detection and quantification of the drinking. So I could easily see some sort of a collaboration project going forward. So the bottom line here is personalized nutrition and training platform using this platform around smart water bottle. Okay, so now let's switch gears a bit and let's talk about smart homes. So here we are in talks with a smart TV manufacturer where they are trying to see how is it that the smart TV can act as a connected hub, and along with wearable devices such as ours, Somatics' safe being smart band, how is it that you can improve the quality of life of senior citizens? So here the components of this connected health platform would be the smart TV that acts as a hub, Bluetooth enabled medical devices, along with our smart band. So here's sort of a mocked up screenshot of what type of data the user, in our case elderly citizen, would look at on their TV screen. Oh, so what's their activity levels, their vitals, what are the appointments that they have, certain reminders about medication intake, what are their health trends looking like, are there any televisits that they need to do, just using the remote control. Also they can press the health button, like what are the exercises that they could do using the TV. So how is it that you can bring the smart TV, which acts as a hub, pushes the data onto the cloud, along with some of the other devices, such as the smart bands and other third-party medical devices, Bluetooth-enabled devices. So here's sort of how that workflow would look like. You have the smart band, you connect it to the cloud, either through Wi-Fi or through BLE, and then you connect it to the smart TV hub. You also have other appliances in the room, whether it's the refrigerators, the air conditioning, the lights, the washing machine. How is it that it can all come together to not only collect data, but also once you have identified the trends and patterns in terms of when a person is waking up at night, how often. So if the person is waking up, is not having restful sleep, is there a way that we can trigger a signal to, let's say, the smart speakers, whether the Alexas of the world, and play some soothing music, right? This is all based upon the fact that once we identified that a person is not having a restful sleep, right? So there are these multiple use cases that we come up with. I just want to make the audience aware a little bit as to what are the possibilities here of bringing all of these smart devices together under a single umbrella with this smart hub, and thereby improve the quality of life of a person. So once again, sort of double downing a little bit on the previous two slides, some of the things that we are thinking about, here on the left hand side is what is it that Somatics' safe being platform can do. We talked about the walking, sleeping, hydration, heart rate, all of the data that we collect continuously, passively, 24/7. Also, we can integrate with third-party devices such as blood pressure cuffs, scale, blood oxygen saturation meters, and then push all of that data into a single platform so that you can have a holistic view of a person's health. Then that combined with the devices that are sitting in a home, right? The speakers, refrigerator, the washing machine, the vacuum, air conditioning, the lighting, right? So here on the right hand side, how is it that you could collect all of the data and put it all together to give a and build a picture around the holistic health and wellness context of a person. So some of the use cases that we identified are around UTI. I talked about that for quite a bit in the previous few slides. The frequency of the trips to the bathroom, which increases, if there are frequent trips at night, it's dark. So there's that potential of a person falling. In fact, some numbers show that in the US alone, there are 800,000 falls every year, which is a pretty big number. So how is it that you could avoid? Okay, so if you identify that somebody is at a risk of falling, they're waking up frequently at night, so you could, based upon the location of the bathroom versus their bedroom, the path towards that, you could turn on the lights so you can avoid those falls, right? The dehydration piece we talked about in the previous slide, falls, then sleep analytics. You can get these deep analytics, not only just around the quantity of sleep, but also the quality of sleep. And how is it that you can bring all of that together to build that picture around the health and wellness context of a person, and thereby further improve their quality of life, right? So here are some other examples. Waking up at night, we talked about it. Then the IoT devices communicate with each other. Let's say if someone is sleeping, at that time you don't want to turn the washing machine or the vacuum. So all of that could be set automatically through the settings based upon the data that gets collected. Okay, so finally, I would like to summarize by saying that remote patient monitoring is a powerful tool to provide not only unique insights and alerts, but also to reduce the clinical risk factors. I think, if anything, COVID has really accelerated the adoption of technology in the healthcare space, which traditionally has been slow in adopting new technology. I am truly excited about the future. Technology has great potential to unlock and improve the quality of life of people. And I'm seeing this shift from moving from clinical insights to health outcomes. And like all of these things, whether it's around smart homes, connected health, wearables, whether it's the wristbands, patches, earphones, everything, all of that shift, all of that usage of data, hopefully at some point in the future, in the recent future, will reduce healthcare costs. Will move from an inpatient setting to a outpatient setting, and also will sort of see that shift from disease care to healthcare, right? And sort of shift from being reactive to being proactive, and then to being predictive, right? With the uber goal of improving the quality of life, and this is something that I'm excited about. This is something that Somatics as a company is excited about as well. So with that, I would like to stop here, and I'm open for any questions. If you want to connect with me, here is my information. You can email me, LinkedIn, Twitter, website for more information as well. Thank you. Thanks for your time.
Thank you, Dr. Amit. That was awesome. That was really interesting. Extremely fascinating what's happening in the wearable space right now. So while we wait to see if there's any questions that come in, let me ask you this: what are your predictions for 2023 in this space?
Yeah, as I stated in my previous slide, I'm really excited about seeing that shift from these wearables um, being an athletic option to truly coming into the health tech, into the healthcare aspect, whereby there is this massive adoption of looking at the data. I think we are really moving in the right direction in terms of improving the accuracy, the sensitivity, and specificity of the algorithm, so that there is this high level of confidence with the healthcare providers to truly adopt these technologies. Right. Then the other
Yep.
thing I'm excited about is AI ML has been there for quite some time, but we also need and want to make sure that there is ethical AI. So there. Like we need to solve these questions or concerns around like the provider versus payer versus patient. How does ethical AI sort of come into play into these aspects? There are certain overlaps between these things, so how do we resolve those things and make sure that we truly build the health equity, right?
Yep.
Then personalized medicine. This is something I'm really excited about. Is that in the past it has been about with having this 80/20 rule, where we are like building solutions, whether it's technology, whether it's drugs, to cover 80% of the population, not necessarily the 20%. But how is it that like technology, especially AI ML, where we are collecting this vast amount of data continuously, passively, 24/7, that can open the gateways towards covering that 20% and making sure that we are building personalized medicine, personalized solutions for everybody, and making sure that everybody has equal access to healthcare and health solutions.
Amazing. Yeah, I'm going to connect with you offline because I have several other questions, but I don't want to take up space. We do have a question that just came in. So, Akasha asked, what is your growth strategy outside in the US? Is it based on partnerships? And if so, what is your ideal partner profile?
Yeah. So currently we are expanding in Europe. In fact, like earlier I talked about this project with Roche that we are doing, where they have this program around innovation in dementia. So this program is being launched in Portugal, where the government there is wanting to improve the quality of life, especially with people with dementia. And this is where we are truly excited to partner with Roche and working with a couple of hospitals in Lisbon. I talked about this medication compliance aspect. That's something that we are building, and that's going to be an international launch for us in Portugal. So super excited about that. But yeah, going to Akshay's question, sort of our strategy towards growth is going to be partnerships, in the sense that you want to build a holistic solution for people. So yeah, we may, like from a variables perspective, like we are double downing on that, in the sense that we are adding more and more sensors onto the wearables. So sort of the phrase being used these days is clinic on the wrist. So you're packing as much sensors as possible onto your wearable, so that you can collect a whole lot of data and thereby provide clinical insights, do risk analysis, and so on, right? But then, I talked about this paradigm around connected health with smart homes, where you're collecting data from other devices as well. and how is it that you can work smoothly with all of that data, so that integration of that data is going to be very critical. I think whoever does that job really well going forward would do really well, both from improving the quality of life people perspective, as well as from a business perspective as well. So I think API integrations of collecting that data, putting it in a single uh, uh, pane of glass, so that you can do your analytics on top of that. I think that's going to be the key. So partnerships, yes, I completely agree with Akshay. That's going to be the key going forward.
Amazing. And they just added a second part to the question. So we didn't hear you talk much about CGM devices. Are these part of your roadmap? And is the trend moving towards using these beyond diabetes patients for preventive lifestyle improvement?
Yeah, like we do third-party integrations, in the sense that especially I am not a medical doctor, so, and I'm not going to be or going to claim to be one, but there are these Bluetooth enabled devices, including the glucometers, so we can collect the data and push it into our platform through those third party integrations. So you can, so that then when the caretaker comes into our dashboard, or we could also, once we put it into our dashboard, we can push that data into EHRs, EMRs of the world. We have done some integration work with Point Click Care and with Yardi as well, so that we push that data onto those platforms. So a user, whether it's the physician, nurse, caretaker, they can go and look into the platform that they are used to. They don't have to learn yet another platform that we are providing. So so we have done some work around third-party integration with these Bluetooth enabled devices.
Interesting. So with that, and something that I just thought about when you were answering that is it's twofold. So part one is there any sort of threat? I'm thinking on an extreme level, right? From security and data, and that being hacked, for example. Like, what is there? Like, I mean, do companies have they have safety mechanisms in place right now? But like, I mean, that this is a newer field, right? So, what are y'all doing, at least from your company, Somatics, in order to keep that data private? And also, how are you utilizing that? And are y'all utilizing that? Like, to Akash's point, like, can you take this to insurance companies and be like, look, if your users wear this, like, you're going to be able to detect a lot more things faster, which will lead to, hopefully making better decisions about the profile of your customer?
Oh yeah, great question. Absolutely. I mean, security, compliance, all of these are absolutely necessary, especially in a healthcare setting where you don't want to give out patient data, and that's a big no-no, right? So we are working with big pharma companies, big insurance companies, and we go through a whole lot of security clearance audit before we even get into like before even we get a seat at the table, in order to have collaboration projects with them. So what does that entail? So that entails making sure that your dashboards are HIPAA compliant, there is GDPR compliance, like PPI, PII, all of these things. You want to absolutely make sure that the data that gets collected from the wearables onto the band, all of the user information is anonymized when we apply the AI/ML algorithms on top of that. So and also, especially when data is being transferred, let's say from the cloud onto our platform, whether it's on-prem or in the cloud, or being transferred, as I said, with these third-party integrations from one platform to the other, you also want to make sure the data that is in motion and also the data that is at rest are all secured, whether it's secured and encrypted while it is put on the wire and transferred from one platform to the other, right? So that 256-bit encryption, all of the buzzwords around security, compliance need to be met, and for absolute good reasons, because any private information, especially health information, getting out is really terrible.
Yeah, I agree. Well, thank you so much, Dr. Amit. We did have a few questions. I'm going to ask Akash to connect with you offline because, I mean, these look like pretty in-depth questions. So, Akash, if you don't mind connecting with Dr. Amit offline in order to stay on track of time. Dr. Amit, thank you so much for joining us today.
Hey, thank you. Really excited to be here. Enjoyed the session. Well, everybody have a great day. Thank you.
Thank you. Have a good one. Awesome, guys. Well, that's it for the morning session. What do y'all think? What's been your favorite conversation? Anything interesting that you learned? Let me know in the comments. So we are going to take a coffee break here for the next 20 minutes, I believe so. And we will be back at 11:45 to have Dr. Martin Gershon, the managing partner at Endeavor Life Science Funds. So thank you for joining us this morning and hope to see you this afternoon.
Test, 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 test.
What's up, everybody? We are back for part 2 of day 2 of Healthcare Summit. So I'm excited to be bringing up Dr. Martin Gershon. He is the managing partner at Endeavor Life Science Funds. How's it going?
Fantastic.
Thank you so much for joining us today.
I'm very excited about being here. It's a gorgeous fall day. Perfect time to talk about healthcare and big tech.
Absolutely. Where are you calling in from?
I am in Hudson Yards in New York City.
Amazing. It's probably a little bit colder than Dallas, Texas. So,
It is.
but I think, I know that you'll be talking today about big tech companies investing billions into healthcare AI, drug discovery, and health and wellness. So the floor is yours, Dr. Martin. If you want to leave 5 or 10 minutes at the end for a Q&A, if not more, it's up to you. But yeah, we have a hard stop at 12:25.
Fantastic. Well, first of all, I want to thank you for the invitation, and it's a great opportunity to speak amongst some really great panelists. I'm excited about talking to you about health and wellness, which has been a part of my life for more than 30 years. The focus of this conversation really is about the new leaders in the health and life science space. Up till now, it's really been a market driven by large pharma, biotech, and med tech companies and service companies. But the game is changed, and it's really just the beginning. So let me talk to you about the 4 biggest healthcare companies, also known as Apple, Google, Microsoft, and Amazon, as they plunge into what I consider a 20-year secular growth market strategy to take over a $14 trillion healthcare industry globally, $4.4 trillion here in the United States. First, let me start by telling you just a little bit about myself so you have an understanding about my perspective. So I do have a varied background. I am an oncologist, an immunologist, and a neuroscientist. And before that, I was a Food and Drug Administration attorney, focusing in on clinical studies, pricing, and reimbursement. I'm also a Google Scholar in healthcare economics. I teach at Harvard and MIT and lecture in the health science and technology programs. I also do some advisory work for the Harvard Innovation Labs as an advisor in their entrepreneurship program. And I do provide consulting services for innovation and commercialization strategies for Fortune 500 companies, as well as buy and sell side firms like Goldman Sachs and BlackRock and Tiger Global. So this is by way of letting you know that I look at things from a non-traditional perspective, and I try to look at things in a strategic way for several years out. Today, we're going to really be defining a new trend in healthcare and life sciences, where tech giants drive a secular bull cycle in healthcare and life sciences, principally because they have an incredibly fast-moving investment machine. They are leveraging their core competencies. They have tremendously deep pockets, and they have a long-term commitment in which they've already put $100 billion into play. And that is really just the start of a multi-decade long drive into the health life science space. Tech giants are investing in 4 areas that I want to make you aware of: AI and machine learning and big data, wearable sensors and at-home diagnostics, drug discovery, and digital health. But why is big tech money flowing into these 4 hot areas of healthcare? Here is the bull case. It rests on 2 fundamental principles. I've been in academics and science and medicine for several decades. Number 1, I have never seen such incredible advances in scientific and medical innovations. That is coinciding with incredible business fundamentals, which are taking advantage of both macroeconomics and the core competencies of big tech. First, let's very briefly take a look at some of the macroeconomic aspects and look at the business side of this equation. We're clearly either in a recession or going into a recession, but that's not really the main issue. The main issue is liquidity. Liquidity tends to run in 10-year cycles, and we've just begun a liquidity crisis. So when liquidity gets pulled out of the markets, we need to readjust valuations, and we need to readjust sectors. And in this market, healthcare will outperform. I've done a deep dive, and according to my research, which is backed by McKinsey, in this transition, we can expect 5 to 10 times greater liquidity going into healthcare and life sciences than any other sector. As part of this business process, commercialization and the development of drugs, devices, and services is faster and less expensive than it's ever been because of friendly regulatory backdrops. We also have incredible pricing power with new therapies like gene therapy, which price out at just under $3 million per patient. And we have a growing market size, both in traditional and non-traditional demographics. In traditional, the population is aging, there's greater access to healthcare, but in non-traditional, there's a change in mindset, which is opening up new health and wellness programs that many of the core tech companies are going to take advantage of. Let's take a look at the 800-pound gorilla, Apple. They are focusing in on one of their core competencies, which is wearable sensors and digital health. They're looking at personalized home healthcare, health and wellness, online fitness, home diagnostics, and integrated hospital monitoring in all of this ecosystem. They have a multi-decade-long plan, which is fairly complex and robust, which includes acquisitions, investments, and partnerships. And according to the CEO, Tim Cook, he believes that healthcare could be Apple's greatest legacy. Morgan Stanley sees Apple's healthcare sales at $313 billion by 2027. Apple is really creating an ecosystem. And even though this is a word that's used quite frequently, in this case, it really holds water. They're looking at several different integrative aspects. First, at home, they're looking at home wearable sensors and home diagnostics. Second, they're looking at fitness and personal training. And then they're integrating all this seamlessly with hospital patient monitoring. What does this mean? It means that the iPhone, the iWatch, and other wearable sensors are going to be a part of our everyday life. We're going to wake up in the morning. We're going to get a cup of coffee. We're going to pull out our iPhone. We're going to swipe left. Heart looks good. Kidneys look good. Uh-oh. Looks like an AI machine learning program at 3:33 in the morning kicked in. I need some more insulin. I need an adjusted dose. Before I even read the paper, that insulin is sitting at my doorstep. That's what we can expect from these changes in health and wellness. So far as Apple, in terms of the personalized at-home healthcare, they're going to be looking at issues with wearable sensors that focus on both health issues, health and wellness issues, and illness issues. For example, they're looking at mobility and fall risk. They're also looking at activity and productivity and performance. They're looking at medications, and they're even going into research. Apple will also focus in on the changing health and wellness world by changing mindsets. They believe that this will empower people. There will be significant education programs and mindfulness workshops. Apple will dominate the at-home online video business. They've already engaged some of the world's best online cyclists. They're integrating many of these programs in a hybrid model, and you can expect them to take over that space, partnering with companies like SoulCycle. They also are looking at the integration of core medical services and changing, most importantly, the point of care. I can't emphasize this strongly enough. The cost of healthcare is not sustainable. Most of that cost is because it's hospital or office based. By shifting the point of care from hospital and office to home, billions will be saved. We can expect over the next several years, according to a McKinsey report, that $265 billion of healthcare services will shift from traditional hospital and office facilities to the home. And Apple is going to capture a lot of that. Let's take a look at some of the things that Apple is already involved with. First, it sounds like science fiction, but it's not. Vocal biomarkers able to detect COVID-19 by simply talking into your iPhone. They're working with a company called Sanofi, and we can expect some great things over the next 24 months from that collaboration. They're working with a company called Cordio. Again, a voice biomarker where you talk into your iOS system and it evaluates your congestive heart failure in real time, giving AI machine learning power to the patient and the physician simultaneously with a focus on improving outcomes and avoiding hospitalizations. They're also looking at-home infectious disease diagnostics. You know, if there's one thing that we've all learned from COVID, we're all fragile. We're all susceptible. I don't know how many times I've been tested for COVID, but it sure would have been nice if I can do all of this, not just with a swab test, which is an antigen test, but with a PCR test with high degree of specificity and high degree of sensitivity. And 3EO is working with Apple towards that end with a plug-and-play model for their iOS system. They're also looking at skin cancer, another chronic treatable disease, and they're working with Skin Vision, which shows a 95% cancer detection rate. And to put this into perspective, if you go to your average physician, they have a 50-50 chance of getting it right. If you go to your dermatologist, depending on the quality of the experience, somewhere in the neighborhood of 70 to 80%. So a huge increase in cancer detection for a treatable disease. Let's now shift to really the biggest player in the space, Google. Obviously, their core competence is AI and big data, and they're focusing that core competence on drug discovery. And they're looking specifically in that vertical at precision medicine, 3D printing, regenerative medicine, organ-on-chip technology, and CRISPR technology. And we're going to take a look at all of those. First, once again, Google, like Apple, has a 10-year plan, fairly complex in investment and partnerships, and being rolled out. They have 250 investments that they've made in early stage companies. These are some of them. Many of them are now unicorns. And over 50% of the Google Ventures team is now healthcare focused, and that is growing. One of the core acquisitions and investments that Google made is a company called Verily. They're using AI and big data to look at precision medicine. What is precision medicine? It's the ability to take data, analyze it for an individual, and come up with a bespoke model that looks at a number of different things. Diagnosis, treatment algorithms, the ability to use drugs in off-purpose use. It gives us a tremendous opportunity as physicians to have an incredible advisor by our side that can think instantaneously and give us choices that we might not have seen as we're interviewing and examining the patient. What does this mean? It means companies like Onduo, working with Verily, are going to improve the diabetic patient community. Specifically, type 2 diabetes is a core focus of Verily and Google. And they believe that by using their AI machine learning services and the app, personalizing healthcare, they can decrease hospitalizations and improve outcomes. And that's what this is all about. Real world problems, real world solutions at a much greater speed than in years past when large pharma, biotech, and medtech companies were really the sole acquirers of these companies. Let's take a look at some of the statistics. Year to date, Google has spent $1.9 billion on big data, AI, deep learning, imaging, and diagnostic companies. And the reason is very simple. The growth rate right now, according to our research at Endeavor, is an annualized rate of 3.1% on the S&P, where healthcare is growing at 38.4%. A lot of the focus that Google currently is paying attention to is cancer diagnosis as well as diabetes. Let's take a look at some of those specific cases. First, colonoscopy, a very treatable diagnostic that goes towards a very treatable disease, colon cancer. Internally, C2D2 was developed as a technology by Google itself with real-time 3D reconstruction that has an incredible 93% detection rate, which is vastly superior than any standard that has existed in the colonoscopy endoscopy world. To the point where a physician who doesn't really need to alter the way that they use the product doesn't have to even visualize the polyp. The AI machine learning algorithms calculate probabilities without even seeing the polyp. So something that is not visible by the physician, which they normally would just ignore, now is picked up and removed. They're also really looking at how big data and AI can work into research. And they're looking into ways to feed this large amount of data into clinical trials. And they're picking diseases that are very prevalent, like skin cancer. And we can expect tremendous advances in terms of outcome improvement in the area of skin cancer. Google is also a very strong investor in groundbreaking drug discovery technologies like 3D printing, organs on chip, regenerative medicine, and CRISPR technologies. Let's take a look at 3D printing. It's really, it's like science fiction. We are printing now human tissues. Boston University has just printed the first miniature working heart. And when I say working heart, I mean vessels, nerves, chambers, valves. It is a fully functioning heart. There is an incredible collaboration in the Boston community, particularly out of Harvard and Boston University, that is going to drive this sector of healthcare incredibly hard. What does this mean? It means that we can test drugs on human tissue, that we do not need to use animal models anymore, which is a huge expense in this process. The current cost of bringing a drug to market is 12.5 to 13 years at a cost of $2.5 billion. My research has shown that over the next several years can come down to approximately 6 years and $700 million. Still very high, but a dramatic improvement. The social impact of this technology is massive. Let's also take a look at some of the other companies like Organovo, who have also done incredible things by creating a miniature kidney. Once again, this technology is designed to address a pain point within the large pharma and biotech communities, which is the heavy upfront costs of doing animal studies. One of the problems with animal studies, besides the cost, is that these are not really predictive of human interactions. These are animals, animal tissues, and drugs don't often correspond in terms of their predictive value when being tested on animal tissue. One of the new areas that's a spin-off in this 3D printing world is regenerative medicine. I can't even begin to tell you the possibilities here, but I will. So first, there's a company called CellLink. CellLink has a microscale continuous projection printing method that creates a complex CNS structure. What does this mean? It means that patients with spinal cord injury can get a 3D printed material implanted in their injured area, and there is a chance that neural networks and pathways will regrow at an accelerated rate. Currently, the rate of regrowth is about 1 to 2 millimeters a month. This will radically change the speed and also the health and construction of those neural networks will be infinitely stronger. It's also used in bone regrowth. So if you have a fracture, this material can be put into the fracture to help speed recovery. One of my most impressive companies that's focused on regenerative medicine, that has a real personal impact for women who are often an underserved community, is CollPlant. They have a singular 3D printing design designed for patients who have had mastectomies from breast cancer. This product will change the course of breast surgery. It is a product that is implanted in the chest and promotes real tissue growth, while at the same time, implanted product is disintegrating over time. There will no longer be a need for silicone implants, which need to be replaced and often have other medical complications. A cousin of 3D printing is organ on a chip, which accelerates drug discovery also by years. These are actual chips where organs are embedded into these chips and tested on various organ systems such as a lung chip, a colon chip, a brain chip, or a kidney chip. Emulate is one of those companies that's a spin-off of one of the schools that I work with in the Harvard Innovation Labs. And finally, let's take a look at the new king in town. That is CRISPR technology. FDA has given a green light for this gene therapy programs to address diseases that are incurable and often fatal. And the pricing of this is just under $3 million per patient. Now, this opens up tremendous incentives for large pharma and biotech, as well as big tech. One of the leaders in this is Bluebird Bio. They have multiple drugs, multiple shots on goal, and we can expect over the next 18 months quite a number of other drugs coming through the FDA process. Let's shift over to Microsoft. Microsoft is leveraging its AI, machine learning, and big data core competencies. They are focused on automated electronic healthcare records, treatment algorithms, diagnostics, and medical billing. They're also competing with Google in drug discovery in areas which we've just talked about, like precision medicine and 3D printing and regenerative medicine. And we're going to take a look at some of these interesting companies that they're focused in on. They also have a 10-year plus complex plan, which clearly involves acquisition, investment, and partnership. The CEO of Microsoft, Satya Nadella, has made it very clear. They believe that their Azure and AI platform is the basis of a game-changing transformation of healthcare. They are putting tremendous amount of money to work. Case in point, Nuance. Their second biggest acquisition at $19.6 billion is an AI voice recognition program that automates electronic healthcare records. What does this mean? It means that when you walk into the doctor's office, they're not sitting behind a computer, they're talking to you. Everything in the room is recorded, it's transcribed, it goes up to the cloud, AI machine learning integrates it. They put together a differential diagnosis. They put together a treatment algorithm plan. They even contact the pharmacy to make sure that drugs are available. This product is in 90% of US hospitals. They are globally based. and in the next 5 years, you can expect them to be the mainstay of all electronic healthcare systems in the world. Microsoft also recognizes the power of AI in pathology and precision medicine, and they're working with exciting companies like Path AI. Path AI looks at the error rates that traditional pathologists have. Human error is embedded in this field, and AI machine learning is looking to remove it. Focus is very simple: improve accuracy, improve outcomes. Microsoft is also looking to dominate the clinical IT solutions space, and they're working with CVS Health to personalized healthcare, and are looking to work with and have integrated Teladoc with Teams. Microsoft is also looking at diagnostics and therapeutics, and they're working with companies like Adaptive Biotechnologies, which is also their version of a COVID-19 diagnostic. You're looking at Envisagenics, which is a predictive model for cancer risk and disease progression, and 1910 Genetics, identifying novel small molecule therapies. Let's switch over to Amazon. Amazon is clearly focused in on digital health. They've made it very clear that primary care, telemedicine, healthcare services, healthcare insurance, and digital pharmacy are all in their crosshairs. What have they done? Well, they're combining AI and telemedicine and digital pharmacy. They're advancing access and new healthcare plan and treatment algorithms. And they're putting their money where their mouth is in an incredibly complex plan, including acquisitions, investments, and partnerships across several different cross sections within health and life sciences, and focused in on a $4 billion acquisition recently called One Medical. The purpose of this acquisition is plain. They want to own the primary healthcare domain. What does this mean? Virtual telemedicine services are going to combine with home and hybrid services, and Amazon wants to dominate that. They're looking at partnering with companies like 30 Madison, which is a local company here in New York. It's a digital healthcare company that provides telemedicine and digital pharmacy plans. They work in a very unique model, which is a consortium of specialty healthcare companies that they roll up into one company. They work with Picnic, Cove, and Facet, just 3 of the many companies, looking at specialty healthcare systems: allergy, migraine, and skincare in these 3 cases. This type of relationship is going to integrate into Amazon's e-pharmacy plans. And Amazon bought PillPack because they know that the pharmaceutical prescription market is $500 billion. And they are offering high levels of customer satisfaction with 24/7 customer support in convenient packages that improve one of the core things that we need in healthcare, which is patient compliance. These are some of the amazing companies that you want to keep your eye on in these various spaces of digital front door, clinical decision support, telehealth, and so on. You can expect to see more and more of these names, and certainly acquisitions are on the near-term horizon. Let's take a look at the impact. What is the impact of what is going on in this world of big tech acquiring at a greater speed, with a longer term plan and a clear exit strategy? And that's the point that I want to highlight here, is exit strategy. As an investor, I look at risk. Risk involves operational risk, it involves regulatory risk, it involves financial risk, and one of the key risks is exit. And Big Pharma has made it very clear that they have an exit strategy as soon as they walk in the door. Pharma, medical devices are now buying, partnering, and licensing with big tech-backed healthcare companies like never before. They're looking at big tech essentially as the gourmet chef in the kitchen, and they're ordering left and right. Case in point, Roche has acquired Flatiron, which was a Google-invested company. Flatiron dominates AI and big data electronic healthcare records, specifically in the oncology space, to improve cancer treatment algorithms and cancer research for the advancement of personalized healthcare. Pharma is also partnering with AI pathology and diagnostic companies. Bristol Myers Squibb, Amgen, Sanofi, Johnson & Johnson are all looking at ways to integrate digital pathology-based AI diagnostics into their core focus, to the point where Sanofi has now developed an accelerator only focused on digital healthcare. There's also tremendous opportunity in licensing deals in early stage AI medical devices, and Medtronic has taken a lead there in an exclusive arrangement with Cosmo, where they bring AI to endoscopy services, again, to improve outcomes. I can't stress this enough. These are incredible innovations. They're incredible scientific discoveries. As a physician, I couldn't be happier that this impacts the health and wellness of everyone. It improves the access to healthcare. It democratizes healthcare. It's just a game changer in terms of the cost and speed to market, but it's also changing the quality of the healthcare. And so I applaud Medtronic for having this exclusive relationship. I also applaud Boehringer Ingelheim for investing now 32 billion euros for investments in R&D and for new production technologies over the next 5 years, recognizing that many of the things that we just talked about are really harbingers of a long-term, multi-decade global growth cycle. Okay, what is the take-home message from this? This is all very well and good. It may be, interesting, but what does it actually mean? It means that our lives are going to be changed for the better. It means that our healthcare system is going to be improved. It means that we're going to have novel new things to look forward to. We're going to live longer. We're going to be healthier. We're going to be more productive. And we're going to look at diseases and conditions that normally we just didn't have the time or money to look at. For me, I am a bit of a dreamer, but I like to think I'm a practical one. I envision a healthier world. I envision a world where incredible technology meets incredible science and medicine and develops real strategic partnerships to solve real life problems. And for me, it's about the integration of groundbreaking science, medical discoveries, and innovation in healthcare. Not because innovation has a cool wow factor, but because innovation in healthcare is about improving the human condition. And I am all in every aspect, from a faculty member to a researcher to developing early stage companies as the director of entrepreneurship and innovation and strategic partnerships. I'm looking at every way possible to take advantage of this really once in a lifetime collaboration between partnerships that have not normally come to the same table. And I encourage everyone to take part. I want to thank everyone very much for the opportunity for me to be here to talk to you about some of my passions, some of my interests that cut across multiple sections of innovation, technology, medicine, science, and investing. And I've put on the screen here my contact information. I'm more than delighted to be able to speak to people who have questions now, of course, after this brief discussion, but as well offline, where there may be synergies between some of the things that you're doing and some of the things that Endeavor Fund is doing, and what we're doing with many of our strategic partnerships. So thank you very much for this time. I really want to thank our sponsor. Tremendous opportunity in a very informal and user-friendly setting tremendous opportunity to talk to you about what I consider the tip of the spear in a long-term play within healthcare and life sciences, which is going to improve everybody's healthcare. And now I'm just going to open it up to questions for people who have a lot of information to digest.
Dr. Martin, that was awesome. Thank you so much for sharing all that. That I got the chills throughout like your presentation, just hearing about some of what the things these companies are working on. Because while we wait for questions to come in, even though I'm not involved in the healthcare space, I do run a early stage startup accelerator program here. But I also sit on the board of this nonprofit, which is one of the rarest conditions ever known in the history of medicine, called Alström syndrome. Not sure if you're familiar with it. There's less than 1,000 cases ever in the history of medicine. So it's an extremely rare orphan disease. And that's where I learned about CRISPR, and I've just been fascinated with what CRISPR has done and is doing and will be doing. And I mean, what I learned through my journey as a board of directors for Alström Angels is that, you can't find a cure for Alström syndrome right now. All you can do is kind of reverse it and slow it down. But things like CRISPR could come in and be that alternative solution. So I can't remember what speaker said it yesterday, but I thought it was really fascinating how healthcare is one of those, industries that you can actually make a good impact and an income, and, it's not just about having the fancy technology or being innovative or all these buzzwords. It's like you're actually changing humanity and moving it forward. So I think that's super impactful. So thank you for sharing all that. I don't see any questions coming in yet, but I think we already connected. I have a bajillion messages, so I need to catch up on them, but I definitely want to talk to you offline. I definitely see some synergy between some of the things that y'all are doing, or you're doing specifically, and how I can be of a resource of any way. So,
well, I greatly appreciate these words. It's all about teamwork, and it begins with a message and communication. And I look at this as a tremendous opportunity to, at the very least, put some thoughts into people's heads that they might not have heard about some of these things. I will say, on a personal note, I've just accepted a venture fellow position down in Texas, so we might be spending some lunches together.
Awesome. Yeah, that'd be great. Yeah, next time you're in Dallas, let me know. So, it's really interesting because a lot of the technology that has been talked about through this summit has been, very AI, ML driven. And it's just, from an innovation standpoint, I was having a conversation with my grandma because she just got an iPhone. She's had a flip phone her whole life for the last 14 years. So she just went 50 years ahead, right, from an innovation standpoint. And I think about how far we've come in just the last 3 to 5 years from an innovation standpoint in healthcare. But yet we're still I feel like healthcare is so far behind all the other sectors, but healthcare's been around and it's not going to go anywhere. So what for you, what is the prediction that you have for, the different technologies in going into 2023?
Yeah. So great point. So, first of all, I just want to highlight the fact that there's no $1 trillion healthcare company.
Wow.
And Tim Oppler, who is a friend and a colleague, he just collaborated in a conference that I did through Endeavor and partnered with Harvard Business School and Capgemini here in New York, looking at healthcare innovation. Tim is a real thinker. He's a healthcare economist. He's an investor. He pointed out that the likelihood of a $1 trillion healthcare company is almost a certainty over the next few years. And that goes to speak to the demand side of the equation. So I think that what we're going to be looking at in terms of all of these technologies are going to be rolled out. And yes, the next generation is already being baked. So Gen 2 products in AI, machine learning, endoscopy, colonoscopy, different types of diagnostics, different types of way to look at pathology. Certainly the whole area of robotics and surgery has changed the shape of surgery. And I think now that we're really looking at integration into an ecosystem where healthcare records are integrating with diagnostics, integrating with surgical procedures, integrating with wearable sensors, And there's a continuum of not just illness behavior as we're taught as physicians, but there's health and wellness. And so people should expect to live longer, happier, healthier. I'm extremely optimistic about the possibilities for the future. In terms of technology, I would put the spotlight on a new area, which is called quantum computing. Quantum computing is not on the tip of everybody's tongue right now, but it's 151 million times faster than any supercomputer that we have. And with that in play, many of the things that we talked about in terms of advancing sensors and drug discovery and 3D printing is going to be off the charts exponentially faster and cheaper. So there's a lot to be hopeful for in the next 10 plus years. I do think it's an exciting time to take part, whether it's on the social side as a volunteer, whether it's on the investor side, or whether it's working in one of these companies. I work, for example, with Harvard alumni in tech. We just had a symposium. We're looking to do our next one, which is really about the possibilities for people with incredible tech backgrounds shifting from fintech and SaaS software into the healthcare space. So that shift is really, I think, hasn't even started yet. And when we see the shift of personnel coupled with new technologies like quantum computing, I mean, this is really just the beginning of a very long growth cycle.
Yeah, no, I mean, that is just unheard of, that type of speed, right? And like what people like, at least in my opinion, what I didn't understand like with time was that, like, for example, like someone that is working 100 hours versus someone that's working, 40 hours, you're working 2.5 times faster, right? So when you're working at 150, I don't know, I think that's what you said, 150 times faster,
151 million.
151 million. I don't even know, like, I can't even comprehend that number, right? It's just like, imagine what we can do in, like, people tend to just think in like yearly basis. And like you said, I mean, the next decade, I mean, everything could be so different than what it looks like today. And that's absolutely exciting. That's definitely encouraging, as we just came through like one of the hardest things with COVID, and, hopefully everyone's staying safe and healthy. But I feel like something like that could help detect something like COVID in the future and avoid a world global catastrophe.
Absolutely. And what we try to do in the core thesis of Endeavor is to provide advisory services for companies that want to scale, grow, commercialize so that they can bring their products to, patients quicker and also make themselves attractive acquisition targets for big tech. And we also work with large pharma, biotech, and big tech to identify those types of companies that are going to be key integrated companies into their own platforms. And then finally, I'm a venture fellow in an accelerator down in Texas, accelerator up, in McGill, where I have a faculty position. These companies will be the next unicorns, and it's our responsibility as healthcare professionals to help make sure that they don't die on the vine in a macroeconomic downturn. So there's really an ecosystem that's being built out with partnerships who contribute at various aspects. And that ecosystem looks at seed series A all the way through to very late stage companies in series D and beyond, so that we can bring these companies ultimately to the final point, which is the large company acquirer. And that transitions into a commercial product, which comes to change the healthcare system, which is what it's all about.
Yeah, I agree. Well, Dr. Martin, we are at our a little bit over our time, but any last parting words before we let you go?
Just a big thank you to everyone, and especially the host and yourself. It's been a real pleasure.
Thank you so much for joining us and all that amazing information. I hope you have a great day, and I look forward to connecting with you.
It's absolutely my pleasure. And if you find this and your listeners interesting, there's going to be a symposium in 2 weeks on December 1st, where I'll be talking to a group of 11,000 people in Spain and Madrid in an AI and healthcare conference. So
wow, amazing.
Yeah,
definitely going to check that out. So I hope you have a great day, and thank you, and hope to, talk soon again.
Fantastic. Thank you so much, everybody.
Thank you. Have a good one. Awesome, guys. Well, yeah, that was amazing. I can't, believe some of this technology that's being brought to the market. It's quite, life changing, honestly. So I'm excited about our next speaker, Rodrigo Hutt. How's it going, Rodrigo?
Hi, Javy.
Can you hear
Can you?
me? I sure can. Can you hear me?
I can. Yeah. How are you?
Awesome. Doing well. How are you?
I'm great. Thank you. Thank you.
Where
Thank
are
you
we
for having
calling
me.
in from?
I'm in Seattle, Washington.
Amazing.
Yeah.
Is it raining?
Not right now.
I feel like that's very rare. So,
Yeah.
well, I'm excited about your conversation on health. It's personal, the power of AI and precision nutrition. I definitely think, for me at least, my personal health is something that I've taken, more as I've just became a dad. I have multiple startups that I've run, and I look at it like with the Whoop, like I look at it human performance optimization, like how I think as humans we can always evolve and get better, and optimizing just like we do with software and business. We should be doing that with our personal health too, right? In order to live longer, happier, and just overall health wise. So yeah, I will stop talking here, let you take over the mic if you want to leave 5 or 10 minutes at the end for Q&A.
Of Dr. D. Martin, he just mentioned many of the great things that are happening in the industry. A very exciting time, to be part of this health revolution. And I bet that many of us here today believe that we are living in the most amazing time in human history, given all the advances in technology. And I've seen the convergence of healthcare, biology, technology, and data science finally coming together. And some of the most amazing minds are working on solving some of the biggest problems affecting humanity. And as Dr. Martin just mentioned before, there has been a lot of great breakthrough innovations that have happened over the years, over the last few years, that has been amazing, and that will continue to be over the upcoming years. Innovations such as immunotherapy to treat cancer, or CRISPR, for gene editing, also wearable technologies to measure just about anything, and also the microbiome, understanding the microbiome and the role of mRNA to really prevent chronic diseases. So I strongly believe, similarly to what Dr. D. Martin just shared, that the industry has been changing quite a lot over the last few years, but it will continue to change even more at a very fast pace, over the next decade. So it's certainly very exciting times. I think that one of the main things to say here is our why. And I wanted to start this talk just by sharing, like, why do we do what we do at Viome Life Sciences. And fundamentally, we believe that lifestyle choices can lead to chronic diseases. And we also believe that we have a solution that can help prevent and revert chronic diseases, which I will be sharing throughout my talk. But first, I wanted to start by sharing some data. This will be new to many of you, but it's worth recapping. Today in the U.S., in the U.S. alone, healthcare expenditures are over $4 trillion. It's the U.S. alone is it spends a lot of money on healthcare. That's roughly 20% of GDP. And yet you can see life expectancy that stopped improving over the years since 2014, and it plateaued. And now, for the last couple of years, it actually has been going down. When you see health expenditures per capita versus life expectancy, you can see in this chart that, and you can compare how is the US compared to other, advanced industrialized nations. And you see the United States with, over $10,000 and a life expectancy of 77 years. And then you can compare that with, for example, the UK that has almost 81 years and spends probably less than 50% of what we spend here in the US. And then if you see countries like Japan or Singapore, they have higher life expectancies with lower healthcare expenditure. So it's very interesting to see that there is something that is not quite right. And then, here we are, in the most advanced nation in the world, and then we can see the rate of pregnancy-related deaths, that it's almost 4 times as high as, as comparable countries. And then, when we see also people living with disabilities and, and chronic diseases affecting daily, quality of life, this disease burden, it's definitely higher in the US than other comparable nations. So there is definitely something going on here that it's worth understanding. And to me, and at least what we believe at Viome, is that that most of the causes of all these kind of burden and complications has to do with chronic diseases. Today, chronic diseases affect 60% of the US population. 60% of the US population, and this represents around 85% of total healthcare costs. So most, the vast majority of healthcare spending goes into treating and managing chronic diseases. When we see at the number of deaths, as leading causes, for death, we can see here, for example, in 2020, we can see that some of the most important causes of death have to do with chronic diseases. You see, for example, heart disease, is the number 1 killer in the US. Then we have cancer. Then we have strokes. Then we have Alzheimer, diabetes, kidney disease, and so on. So here, here's the data very clear to suggest that there is, a big problem that could potentially be, preventable. Why? Because all of the above that I've just mentioned, it's mostly related to lifestyle. What we eat, what we drink, what we breathe, all of that affects, our immune system. And even, if you look at a recent report by the National Institute of Nutrition, we have seen that the nutritional value, the nutritional content of foods have been getting worse over time. In fact, foods, and you can see on this slide, this is a summary slide, where you can see that foods now have less proteins, less micronutrients, and also less carbs, but also more fat. So that's something that it's not also, helping, with our, lifestyle and our nutrition. And there are many factors of the nutritional value that I just mentioned, many things. I'm just going to mention a few of them here. But one of them is commercial agriculture, for example. The use of fertilizers and pesticides, depletes nutrients from the soil. This is not new, but it's something that has been affecting, the quality of the foods that we eat on a daily basis. Then we also have food processing, things such as canning and freezing and drying using many different chemicals to store different types of foods. That's also something that has been, kind of jeopardizing the quality of the foods that we eat on a daily basis. And then we also have, environmental pollution that creates, in our bodies. And that's something that after some time, we need something to start eliminating some of those harmful, substances from our bodies. And then finally, but not least, we have, our daily lifestyle, that you can say things such as stress, fast food, working and, sitting down in front of the computer, all day long, working in our jobs. So this kind of modern lifestyle, it's also affecting, our bodies, and how we then react to potential diseases. So then, one day, and this was around 6 years ago, Viome's founder, Naveen Jain, came with this question. And he said, what if we could potentially decode the human body and understand the body at a molecular level to address chronic diseases. So this was, the big moonshot kind of vision and an idea and aspiration that we had at Viome 6 years ago when we started. And then, we ended up with this mission. We said that we wanted to digitize, we wanted to decode and decipher the human body at a molecular level to address chronic diseases, including cancer and aging. And that has been our mission, for the last 6 years. And the way that we have been doing it, it's with our own approach, which we call biochemical individuality. And we all know here that every other person, it's different. Everybody's different, both genetically and also biologically. So we decided to tackle the chronic disease epidemic through, with a different approach. And Viome's founder, Naveen Jain, he decided that we should approach this problem by taking into account two key insights. The first one is genes and the difference between DNA and RNA. And the second one is the role of the microbiome. That's what I'm going to be spending a few minutes, now explaining why we're doing what we're doing right now. The first thing that I want to say is that, it turns out that your genes are not your destiny. Your DNA is not your destiny. In fact, most chronic diseases are not even associated with your DNA. Your DNA does not even change when someone develops a disease. So let's say, for example, I'm going to assume just for a second that I develop a chronic disease. If I develop diabetes, my DNA does not change. If I develop Alzheimer, my DNA doesn't change. If I develop Parkinson's or heart disease or any other chronic disease, my DNA stays the same. So how come if you have two identical twins with the same DNA, one of them can develop a disease and another one doesn't? And the answer to that, in our opinion, it's RNA. So DNA can tell you what can potentially happen, but RNA and mRNA in particular is the key to understanding chronic disease in our opinion. Why? Because RNA tells you the gene expression. It helps you explain those genes that expresses right now. So by understanding and sequencing mRNA, we are able to tell someone what's happening in your body right now, not in 10 years, not in 15 years, but right now. And by doing that, we can also explain and provide an explanation of why someone has health symptoms that can potentially be prevented or reversed. The second key insight, and this was a big learning for me, when I joined Viome, was the microbiome. And when I heard for the first time that we are 1% human, I said, what? What do you mean by that? We are 1% human. 99% of our genes expressed in our bodies do not come from our mom and dad, right? That was a bit shocking to me. And then I started understanding and reading more and learning more about the microbiome. And it turns out that we have human genes. Then we have, the microbiome, which is the ecosystem of all the microbes within our bodies that consists of, bacteria, viruses, fungi, you name it. And it turns out that the microbial gene is 150 times larger than the human gene complement. It is quite shocking to me. And also, it turns out that most diseases, around what some doctors and scientists claim, is that around 90% of diseases are linked to the microbiome. So why is this important? Why is the microbiome an important thing in our lives? And it is important because of this. What we eat fits our microbiome. So it doesn't really matter, who is, what are the microbes in our body, in our bodies. What we eat affects the biochemical reaction of the microbes that live within our body. when your microbiome is out of balance, your immune system is out of balance, and that creates chronic inflammation. And when you have chronic inflammation, it can potentially lead to a chronic disease. And on the right, you can see there is a lot. If you go to Google and start searching microbiome and heart disease microbiome and Alzheimer microbiome and gut disease and dysbiosis, you will find a lot of research studies that it's starting to suggest that that the microbiome and chronic diseases are very much linked. So now to the good news. The good news is that we believe that a few lifestyle changes can dramatically improve your energy, your health, and your longevity, and potentially prevent chronic diseases. There is a famous quote by Dr. Ornish that summarizes what I'm trying to explain here. And it says, eat well, move more, stress less, and love more. And at Viome, we focus on the first recommendation from Dr. Ornish, eat well. And then, but on top of that, it's not that easy. It turns out that easy to decide how to eat well. In fact, most people want to eat healthy. Most people do want to eat healthy, and yet nobody knows what foods are healthy for themselves. There is a lot of diets out there. There is a lot of fat diets, and then most people, and I've heard this myself, throughout my life, is that you should eat your greens, and you should eat arugula, spinach, broccoli, you name it. And then what happens is that what if I can't digest oxalic acid or sulfite? Not all greens, just because they're greens, are something that will be beneficial to your body. And we are not the first one to claim this or to say this. Hippocrates, the Greek physician, many centuries ago, he said all diseases begin in the gut. And also, the other famous quote is one man's food is another man's poison. So there is not such thing as a universally healthy diet. So that's why, at Viome, our mission and our vision for what we do is that we want to empower people live healthier lives through precision nutrition. And then there is another quote, very famous quote, that says, "Let food be thy medicine and medicine be thy food." So this is what we do at Viome, and this is how the process we are approaching this problem, and this is our contribution so far. So I'm just going to walk you through very high level of how we do what we do at Viome, and it all starts with collecting samples. We have an at-home test kit. We have 3 versions. One that collects stool, the other one collects stool and blood, and our newest version, which is called Full Body Intelligence, we collect stool, blood, and now saliva. So we collect, you can get it at home. You collect samples at home. You send it back to our lab. We have our own lab that analyzes the samples and the phenotype data from the questionnaires when you register. And then, after we analyze and apply AI to the data that we collected, then we provide health scores, health insights, food recommendations, and supplement recommendations via our mobile app. And then after that, in addition to that, we also provide and started producing a unique formula for custom-made supplements and prebiotics and probiotics to supplement our recommendations. And then step 5, which is very important step, is to retest. At Viome, we suggest that we should all retest every 4 to 6 months. Why? Because the microbiome is dynamic; it's not static, and that way we can update the insights, the progress, the food recommendations, and the supplement recommendations as we continue our health journey. Here is just a summary of how we do it. Ultimately, our goal is to make nutrition simple, right? So in the Viome map, you're going to be able to see where you are today in terms of your health scores. and we measure your immune health, we measure your gut health, we measure your mitochondrial health, we measure many different things. And then based on your scores and your results, by applying AI, machine learning, we are able to provide, very specific food recommendations and supplement recommendations as well. Ultimately, these are the 3 steps or the 3 key recommendations that I would give anyone who's trying to improve, their nutrition. This is what I do personally on a daily basis. I have my nutrition plan that consists of 3 key things. The first one, I have a clear understanding of my avoid foods. So based on my biological scores, my biological data, I can now understand which are the foods that I should avoid because they are affecting and causing stress to my microbiome. Then I also know what are the foods that are my superfoods, the foods that I should be eating more, and doubling down on eating more of those foods that are, contributing the nutrients that my body needs right now. And then finally, we also, I also take the supplements, which it's exactly I get a list of what are the supplements and the probiotics and the prebiotics that my body needs right now based on how my microbiome is today. And then, how do we do all of this? It's, we provide recommendations based on our, proprietary AI model. And how it works at a high level is we take many different data inputs from many different data sources, such as, the biological, samples that we collect from each person. We also collect, a simple questionnaire to understand a little bit more about your history and your health history. We collect data from allergies, medications, and so on. Then we apply our AI model, and then from that, we provide the food recommendations and the supplement recommendations. If I dive a little bit deeper to explain how our AI model works, is this. It'll start with a food database of, hundreds of foods that we all eat every day. And then we apply 2 AI models that we have developed, at Viome. The first one is the glycemic response prediction model, which basically it's an AI model that helps predict glycemic response using machine learning. Just to give you an example, let's assume for a second that I eat a banana or an apple. I can see if by eating a banana or an apple, I get a glycemic spike in my results. And I might get a spike in my glycemic response, and another person might not get a glycemic spike by eating that particular food. And then the second model that we apply, it's the microbiome pathway analysis model, which basically looks at the activity or the biochemical reaction that happens from many of these pathways. For example, what happens to our butyrate production? What happens with oxalate elimination? What happens to sulfite production? So based on those 2 models, we are able to categorize each food in 4 buckets, in 4 of one bucket. So for example, some foods will end up in your superfoods bucket, some others will end up in your minimize foods bucket, and some foods will end up in your avoid foods. And those are the foods that you should be avoiding, at least for the 4 or 6 months before you retest again. And then on top of the foods, we also believe that supplementation it's super important, and we take more than 200 ingredients from vitamins, herbs, minerals, amino acids, food extract, enzymes, you name it, everything, and we create a unique formula robotically just for you based on your individual biology. We believe that the perfect combination is to combine the right foods, eliminate the wrong foods, and also take the right supplements on the right dosages at the right time. It's impossible, even if avocado is a superfood, or a strawberry, it's a superfood for you. It's impossible to eat 10 pounds or 20 pounds of strawberry every day. So that's why also, taking specific supplements on the right dosage, it's super important to have the full nutrition plan. Each person gets a unique formula of food extracts, vitamins, herbs, probiotics, prebiotics, the whole thing. It's a unique formula that has been built in our manufacturing facility, and this is an example of mass customization that we are doing here, and we are providing this formula of supplements and antibiotics, and we send it to our customers monthly to their homes. So essentially, we tell you exactly what you need in terms of the supplements and the vitamins and the herbs and all of that, when you need it, how much of each of these supplements you need, and also we explain why you need it. Why, if you take a specific supplement, will impact one of the scores. For example, the graph on the chart on the right says that my microbiome health is at 27, which means that it's not optimal. So now I know which foods and which supplements and which probiotics I need to take on a daily basis to be able to improve that score and take it to an optimal level. As you can see, each formula is completely unique. Not one person is going to get exactly the same food recommendations or supplement recommendations because each person is different. And maybe right now I cannot eat tomato because tomato has a virus that affects my microbiome right now. But maybe in 6 months, when my microbiome has changed and I retest, then it might be the case that tomato becomes a superfood for me, right? So anyway, that's been what I wanted to share with all of you today. We believe that by eating the right whole foods, taking the right nutritional supplements and the probiotics and the prebiotics is the right way to go forward to have the optimal nutrition program to potentially prevent and revert chronic diseases. So thank you very much. And now I'm gonna pass it over to you, Javy, if in case anyone has any questions.
How's it going?
Good. Can you hear me?
I stuck for a second. So that was awesome. So funny story, actually, while we wait for questions to come in, I was like, your company sounds so familiar. I was like, I've heard it before. So I couldn't figure it out. I was like looking on LinkedIn last night. And then this morning I was texting my mother-in-law, and then I was sharing her some of the stuff that because the Leaky Gut is a book I read over the summer, and something, that I started doing more of. I'm not going to lie. I chose Lumen as the choice at that time, but I'm really intrigued by a lot of the stuff you presented now. And as someone who's like I'm trying to take that next step and next level. This sounds extremely fascinating how it all works for, I'm a very analytical person. So it's really cool what y'all are doing. So I was like, I finally figured out, I texted her, it was June 6th, the day before my birthday. I was like I shared her like how y'all do the quiz and stuff. And I was just like, I knew your company sounded so familiar. So, it's really cool that who would have thought I would have been connected, we'd be talking right now. So I applaud everything that y'all are doing. And, a question I have for you is, as we are finishing up, the year, what is a prediction that you have for 2023 about the space that y'all are working in right now?
That's a big question, big question. But I think that we are just at the beginning of the health tech revolution. I think that we have made a lot of progress over the last few years with amazing breakthrough innovations, and I think that it's not. I'm just not going to say this for 2023, but I can say that for the next decade, the health tech industry and biotech will revolutionize the healthcare industry for sure. I would say that just what happened to the retail industry with e-commerce like 25 years ago, and what fintech did to the financial services industry like 10, 12 years ago, I think that right now is the time for the health tech industry to properly disrupt, many of the incumbent companies that that have been operating in healthcare for many, many decades. Um, I've spent I've been in the health industry for 19 years now, from different angles, and I can say that to me, the next decade, it's gonna be amazing. I think that we're gonna be able to see, you know, fantastic advancements in many different, diseases. We're gonna be able to prevent and manage cancer in a much better way that we do it today. We're gonna be able to, uh, make huge progress with anti-aging as well, and overall wellness. But my hope is, and this is why I am super passionate about what we do at Viome, is that I believe that if we can contribute to humanity by preventing chronic diseases, just by doing that, I would be more than happy of what I do on my daily work, simply because I know that most of the chronic diseases that happen today, are potentially preventable if we just make some meaningful adjustments with how we live our daily lives.
No, I completely agree. I think, every single one of the speakers that's spoken throughout the past 2 days, I think the message that I've gotten, from is just like the impact that health tech is about to have on humanity and society in general. Like you said, I mean, those revolutions in fintech, in e-commerce, right? Like you would think that healthcare would have came already, right? Because it's an industry that's been around a really long time, is not going anywhere. But I think partially, and this is just my point of view on it, the establishment, they've kept it a specific way, but now with technology and the internet, that broke down that barrier, and while the entry barrier is lower, I feel like there's so many opportunities that are going to come to the table in the next decade plus that are going to just revolution. Like the way that we live today is not how we're going to be living 10 years from now. And that's extremely exciting. And for me, I run a pre-seed accelerator here in Dallas, and I'm spoiled because I get to see a lot of these cool companies that are coming across that are up and coming. And I just for me, there's something about working with very early stage companies that there's this thrill, the hunt, that you are on the brink of something revolutionary, that your back is up against the wall and you just got to figure it out, otherwise you're out of business. So I think it's really cool what y'all are working on. I'd love to learn more. I'm going to connect with you offline just to chat, as this is something that I personally have taken, very serious. We got to keep our chamber healthy, right? And
Absolutely. Now it's fantastic that we can really understand what happens, inside of our bodies in a more precise way. For many, many decades, it's been a black box to many of us. And right now, with the technologies that have been evolving, now we can, truly understand much more than before, like what's happening inside of us. And it's, very exciting to me. I think that this is teamwork. I think that everyone here at this event, we are together in, working to really build a new generation of healthcare companies that will, dramatically improve the lives of billions of people around the world. So it's very exciting, and looking forward to collaborating more with all of you.
Yeah, no, absolutely. Well, thank you so much for joining us, Rodrigo. Any last parting words before we let you go?
No, thank you so much. Very exciting, and thanks for organizing this event, which is it's amazing, very well organized, and an amazing set of speakers that you've put together for the agenda. So thank you so much.
Thank you. Well, it wasn't me. I'm just the host. I'm just the MC. But I get the fun job of bringing y'all on stage and kind of letting y'all speak and learning from y'all. So
Thank you to Glorium Technologies. So yeah.
Thank you so much for joining, and we'll talk soon. Have a good
thank
day.
you. Thank you. You too. Bye. Thank you.
Bye. What's up, everybody? What another great conversation with Rodrigo. I'm excited to bring up our second to last speaker, Michael Leung. He's the co-founder at Spec, and he'll be chatting with us about using artificial intelligence for detection of systematic diseases and retinal images. Michael, how's it going?
Hey, good. How are you doing today?
Doing well. Thank you for joining us.
Thank you for having me. I'm super excited to have this opportunity to talk to such an exciting audience today.
Yeah. So usually you have about 45 minutes. If you want to leave the last 5 or 10 for any Q&A, it's been me mainly that's been asking the question. So hopefully the audience can chime in a little bit. But I'm going to stop talking and I'm going to give you the mic if you want to introduce yourself and take over.
Sure. Thanks. I think today, happy to share a little bit more about what we're working on and just show the excitement of what eye disease and the eye can do for all of us. Hopefully I won't take up all 45 minutes, probably around 20 or 30 minutes, and then we can have a conversation. I think that's where a lot more of the conversations happen. So a little bit of background about myself. So I'm Michael, I'm one of the co-founders of SPECT, where we are envisioning the future of healthcare. Let me see if I can share my screen. Is that working? Can we see? Yes. All right. So at SPEC, we are envisioning the future of healthcare, and the emphasis here is on, right, because we are looking at the eye as the gateway to your health. And so today, I've been and to the whole team for inviting me here to talk about how technology has changed the healthcare industry, and specifically, my talk will be talking about how it's changing the healthcare industry and care. And so just a little bit of background for everyone, just so that we're all on the same page, where we are looking to as the modern day tricorder. So if there are any Star Trek fans out there, they create this device that you scan, the whole body, and you get a lot of information about the whole body. That's where, we as companies see ourselves go. So let's start with just a little bit of background about the eye and the retina. This might not be, everyone. We're looking at the retina. That really is the back side of the eye. And so that is the layer where a lot of all the light focuses on at the back of your eye and enables you to see, right? So when you see something, you're focusing, you're looking at yourself in the mirror, that light goes through and travels through the pupil of your eye, the front of your eye, and lands in the back on the macula. So that there in the back, that's the photosensitive part of your retina where you have, your rods and your cones. So if you look at the retina, this is what we can see when it's imaged by fundus camera. It's components, and I really want you to focus on these because that's kind of what will give you the sense of what we are doing with the retinal images and being able to use it as the tricorder. So you can see here on this image on the right, you have the optic disc and the optic cup, and you are coming out of there. That's really the socket that plugs into your brain. So when you've seen those images of eyes just dangling, hanging on from a thread, that's really where the connection is between the rest of the body and your eye. And then a little bit further out on the right, as I mentioned earlier, that's really where all the light focuses on in the back of your eye. And so when you're looking at things, that's where all the light goes. And this is why it's a little bit darker. It's black because it's absorbing all of that light. And then see these blood vessels, both arteries and veins that feed the blood and the energy that it needs to operate. And then hidden in here too, the nerves that transmit the information back from the fovea and the macula back to your brain, so you can interpret and understand what you are looking at. And then if anyone has any questions, please feel free to at window at any time. I can go through things in more detail. And so why are we looking at the retina? Well, as I mentioned earlier, the retina is really this wonderful space where you can see both the blood vessels and the nervous system, the vein. You can see this from the exterior in a way that is non-invasive. So in reality, what you're getting is you're getting a biopsy without needing to do anything invasive. And fundus imaging is a great way to access that. And what we've call it is the check light of your body, right? And so in your body, it will show up first and foremost in your eye. You can see 3 different images. These are the last images of the retina. So hopefully, we won't be grossed out from these for the rest of the presentation. We can see on the left, this is what a normal, healthy retina looks like. Blood vessels that are feeding into it. In the middle here, you can see that there are a little bit of blood vessels, little red spots, blood spots, and white spots, and those are hemorrhages. So the blood vessels are leaking, and in this case, doesn't affect your vision yet. But if left untreated, start to creep towards the macula, lose your vision, and that's most of the time when people show up to the eye doctor, to the ophthalmologist. And then over here on the right, you can see the big lesion, retinal detachment. This could be caused from a variety of different factors, whether you're playing with laser pointers and you're burning a scar in the back of your eye, or trauma or cancer, things like ways that the retina will show up and act as that canary in the coal and let you know that something's not right with the body before the body really reacts and has any adverse. We see the retina and the eye as a future of healthcare. So a little bit of history. So how do you get that retinal image? Well, this started, not that long, 2 years ago, where the classic ophthalmoscope was created. This is the device you see on the left. And surprisingly enough, have one of these devices on the wall. If you picture the last time you went to your family doctor's office, they have it hanging on the wall. There's 3 things. One that they can measure your blood pressure with, one that they'll stick your ear to look at, and the third one is this item here. The one on the right side is the ophthalmoscope. Now, unfortunately, not many physicians and family doctors will actually pick up this device, given that it's not that easy to use. And second of all, once they do see in the back of your eye, they don't really understand, what at times they'll just let that go. And if you show up to your family doctor and you're like, hey, I'm having vision issues, they'll just say, let's refer you to the specialist, and they'll take a look. Now, when you go to the ophthalmologist or the optometrist, right, your eye specialist, they'll use what is a bit larger. It's this device right here in the middle. But as you can imagine, very large, very cumbersome. And I'm sure a lot of you have had that experience where you get your head, shoved into the stand, with the chin and the forehead, and then this big intimidating machine comes to your eye and captures images. We've been going since then. In the early 2000s, there's been this revolution of moving towards more portable, transportable things, and now we have what is called the mobile retinal camera. Basically, some sort of handheld device. It could be cell phone based or other electronics, a couple of lenses, and being able to just the patient's eye and capture images. That's maybe a little bit more parallel to the stethoscope of the eye. Now, where the interest has come and where AI really has shined started a few years ago. Let's see. So using AI in the retina, this started really in 2018 was really when we had the big explosion and interest in using AI and looking at the back of your eye and being able to predict things that extend beyond eye care. Google really send shockwaves through the AI in the medical community, the back of your eye, and do a lot of cool predictions, both on the cardiovascular side and other places. So if we can see here, this is the paper that they publish in Nature Biomedicine. They're able to predict the age, the gender, if the patient was smoking or not, what their body mass index was. And this is really, as I mentioned earlier, sent shockwaves through the healthcare system, because you can ask your eye doctors, right, whether it's your optometrist, your ophthalmologist, or even your retina specialist that spend all day, every day, at an image of a retina and predict, the age or the gender of the patient, they would get it wrong 29% of the time. For gender, they'd get it wrong 50% of the time. They'd be guessing. To us as humans, there is nothing obvious or differentiating between a male or machine learning and AI, and you feed it a large enough database, that's when you're able to pick some of things up. And I like to draw the comparison between retina and your genome, right? Your DNA, where your DNA has a lot of information encoded into it also, but we as humans on its own, looking at all those, the A, the T's, the G's, and the C's, we can't differentiate, if you're going to be Asian, if you're going to be African American, or if you'll have blonde hair or dark hair, blue eyes. We can't tell that from our eyes, but with machine learning and AI and a large enough data set, these things become obvious and very clear. So just to show you, so these are some of the results that Google had published. And you can actually see pretty good correlation between what was predicted and what the actual results were. So on the left here, you can see the prediction of age. Y-axis is the predicted age, and then on the x-axis is the actual age. A pretty good correlation. There's some variance in the predicted age, and that's because we all age at different speeds. Sometimes people where their biological clock might look younger or older than their similarly, here on the right, we can look at the blood pressure prediction. So prediction of blood pressure is the actual blood pressure. A little bit less correlation here. It seems the AI is pressing them all into the central band. But again, this is based on a fairly small subset data set in research. So if we look at some of what they were able to predict, very predictive, p-value well below 0.001% for everything from age to blood pressure. So SDP and BP is the systolic and the dialysis blood pressure, your BMI, your body mass index, and then your HbA1c. This is an indication of of diabetes body. So very predictive in being able to predict where you are. Now, being able to predict the age, the gender, the blood pressure, it's cool, but it's not really clinically useful, right? If I'm close enough to you to capture an image of your eye, there are ways that I can look and determine your age and your gender through other means. But what this really has opened the door to the research community is that they're like, hey, there's a lot of information actually that's encoded into the eye. And we've seen a slew of articles being published every day looking at, as I mentioned, systemic, that one's already understood, but looking at cardiovascular disease, so predicting heart attack or stroke or other adverse cardiac events. We're looking at the neurological side of things, so being able to predict Parkinson's or Alzheimer's. Sorry, that's supposed to be Alzheimer's, not stroke. Or even in the nephrology side, so looking at chronic kidney disease. So really anything that affects your nerve or affects your cardiovascular system, your blood vessels, will show up in the eye. And we as humans don't really know what it is. Maybe your blood vessels are a little bit bigger, they're a little bit more red. We don't know how to interpret it, but again, with machine learning and AI, the algorithms have identified this, and with shockingly good accuracy. So here are some, some of the recent news articles that we've seen, in the last few years. If you look at the first one, Google's new AI algorithm able to predict heart disease by looking at your eyes. Able to predict Alzheimer's disease, early warning of Alzheimer's disease, being able to retinal imaging, being able to predict likelihood of stroke, and even things as crazy as COVID-19, right? Maybe you're able to detect fever, higher temperature, things like that. Now, actually, this has all been academic research setting yet. And here at SPEC, we asked ourselves the fundamental question of like, how do we translate this from an academic setting to be used in a clinical setting, right? Where we can actually use this information every day to help them make better decisions in life. And the second question has been, how do we capture annotated high quality data, right? A lot of this data lives in university institutions, and big reason why Google's first paper showed only things about age and sex and blood pressure it had access to. But we don't know if you had access to additional data. Maybe it's you had a headache and that's why you showed up to the doctor that day. But what causes that headache? Or maybe it's things around pregnancy, or you had cancer, or other things like that. We don't have that data today. Your retinal images. And that, right, to build out this AI, we need high quality images, and we need it annotated with the right data and metadata. And so what we've been thinking about is this problem in eye care. So as I mentioned earlier, eye care, these retinal cameras haven't been these mobile retinal cameras haven't been deployed yet. They're not something that's easy to use. The ophthalmoscope, and then on the other side we have these large desktop cameras that are very limited in scope and in only being present in optometry and ophthalmology's offices. And COVID has exacerbated the situation, right? A lot of people are no longer visiting their eye doctors for their annual screenings, just like it has happened with every other screening. When you think about breast cancer or colon cancer, through COVID, these what were supposed to be annual visits just have gone down to basically zero. And hopefully this year and next year we'll see those pick back up and normalcy. Where we've started our hypothesis and thesis has been around in diabetic eye disease. So diabetes and diabetic retinopathy is the largest case of blindness, the largest cause of blindness in working age adults today. And it's completely preventable if it is caught early and treated. Unfortunately, as I mentioned earlier, a lot of times, because it's asymptomatic to the patient. So the patient still sees 20/20. They're like, I still see fine. Why would I go see a doctor? Why would I go see the specialist? And that's really where the problems arise, right? When it starts to affect their vision, and then that's when they go to the doctor and they're like, hey, doctor, I'm seeing blurry, I'm seeing red, I'm seeing flashes of light. It's usually too late to reverse the treatment at that point. What we can do is really just prevent it from progressing worse. But had we caught this patient, anywhere from 3 months to 6 months earlier, when they weren't having any symptoms, but were already showing signs of disease, could have been treated and saved and kept them seeing for the, for another long period of life, and really improve their quality of life. And so, critical screenings are not happening. And the other part of that problem is that there's a shortage of eye specialists. There's only about one eye specialist for every 17,000 Americans. And so as you can imagine, there are not enough specialists to see and do those yearly screenings with needs. So what has SPEC done about this is what we've created, tapping into this $40 billion opportunity. We've created a platform that enables any healthcare staff to perform an eye exam and the eye. So when you hear the word stethoscope, you think of something small, that's portable, and that's easy to use, right? Your stethoscope is used by everyone in the healthcare industry, whether it's a nurse, a medical, paramedic, or phlebotomist. And that's really what we've enabled, the health using this portable handheld see on the left. We're able to provide retinal examinations to anyone. And we've coined this term of eye care anywhere. With healthcare staff, you're looking at nurses and others. There are a lot more of them in the United States and around the world, in the providers, which gives us a much better ratio of one healthcare staff to every 66 Americans. And by enabling and leveraging this lower cost staff, we're able to really enable eye care anywhere and no longer bottleneck critical screenings. And on the other side of the things, we want to be able to allow our ophthalmologists, our eye specialists, to practice at the top of their license, right? So practicing at the top of their license means letting them do what they've been trained to do, right? They went through a lot of school and residency to treat patients, to take care of patients and to treat patients. They're not there to do the screening, right? Ophthalmology is the one specialty where today we go to the specialist for screening, right? We're like, hey, I don't know if I have an issue, but I'd like to get screened. Whereas with every other specialty, whether it's cardiology, pulmonology, dermatology, right? Looking at the heart, your lungs, your skin. By the time you see the specialist, you already know what is wrong. And your family doctor is able to give you a sense of how urgent it is, right? Is it something that like, hey, this is concerning, you should go see a specialist in the next, month or two, or this is, very dangerous and you should go to the emergency room and get treated in the next few hours. Ophthalmology is the one place where if you go to your doctor today and you're like, hey, I'm seeing, flashes of light, or I'm, my vision is blurry, they really can't do that first level triage and will just send you to the eye specialist today. So how does it all work? So the mobile stethoscope is a FDA cleared device that is in the market today. We are able to do the screenings in under 3 minutes. And so much faster turnaround time, right? As opposed to waiting the 8 weeks of doing an appointment with your eye specialist and then going and showing up there. Now, obviously, there's some challenges to that. A lot of these staff, as I mentioned, your nurse, your medical assistant might not know what an image, what a healthy or unhealthy retina should look like. And this is really where our telemedicine platform comes into play. And so we have a specialist that will connect with the device. As you can see, it's, as I mentioned earlier, with some optics. And we're able to really teach the user how to do that. So we'll connect to the phone, we'll tell them like, hey, this is how you hold the device, bring it up to the patient's face, move left, move right, and capture the images together with them, and ensure that the images that are captured are good, that they're not blurry, that they're of the right regions that we want. And at that point, that's it. Those images get sent to our backend, where today we have human ophthalmologists that will grade the images, prepare a report, and send it back to the clinic, to the care provider. But in the future, we will be leveraging machine learning and AI to provide that first level of screening. As I mentioned earlier, a lot of information that is found in the eye, none of this has been approved for the FDA yet. And so for the care provider, the interaction with SPECT is very much like a blood draw, right? Where they draw blood, they send it out to a lab, and then they get a report back with the numbers and the results that they really care about. And that's really, what we provide as a service. Through the pandemic, we've been able to grow really rapidly in the at-home market, in virtual care. As with many other practices, patients were not going into the office, but wanted to receive the care where they are. And optometry and ophthalmology are one of the ones that suffered because of that, because, as I mentioned earlier, a lot of the cameras are these big, large, bulky systems, right? To go get your eyes checked, to get prescription, for refraction. Again, you need to sit in the chair. They've got these big machines, and that's not really portable. But over time, this will be something that we're expanding into other avenues today, such as, physician associations, FQHCs, ACOs, and eventually into the payer market. And then, so as I mentioned earlier today, we're kind of in this stage one where the patients need to go see a healthcare worker. The healthcare worker interacts with our telemedicine platform, and then it's reviewed by an eye specialist. In the future, we are working on this in the next few months is to get some of these portions automated, using an AI-based grading system, replacing the optometrist. But looking long term, we see this very much like the blood pressure cuff, right? Where initially the blood pressure cuff only existed in your family doctor's offices and eventually showed up, into the pharmacy, right? Where you can stick your arm into the big machine. And now you can buy them over the counter, and I have one for my blood pressure, but that doesn't exist for eye care yet. And so here at SPEC, this is kind of where we envision, really the future of eye care is going towards. Is today, it's only in ophthalmology. We're trying to bring that to higher into paramedics, into emergency medicine, into phlebotomy, into labs, and then eventually we can create these kiosks where you can go, put your face in it and take an image, in pharmacies where you can use it on your own without the need of a trained technician. And then long term, we'd like to obviously this where it could be where you could just buy it and bring it to the home and use it at home. Unfortunately, we're not there yet. These are, there's still a little bit of lobbying with the FDA that needs to happen before we get there. But just like with the blood pressure cuff, that's kind of where we're envisioning the next few years. And you're looking at that large market, $10 billion that we're spending today in the eye care market, and then in more generally the eye care diagnostic market, some 30 billion or more range. But as I mentioned earlier, right, we're not just looking at care, but really the eye and the retina as a biomarker to body. So looking at attack, stroke, looking at neurological risk like Parkinson's, Alzheimer's, and many other things that today we don't know because we're not measuring it. And we're estimating that to be somewhere well above $80 billion market. And so to bring this back to the beginning, this information, right? How do we envision the future of healthcare? How is technology changing healthcare, especially when we look at the eye? We see this as being able to democratize access to healthcare and eye care for everyone. We see this as being able to save vision. There are way too many, American and humans worldwide that are losing their vision today just because of underdiagnosis, because they don't have access to the right care systems and doctors and to get this done. And then looking back at this tricorder, right, for Star Trek fans out there, like we want to create this tricorder where you can take an image of the eye and really understand a lot about the patient, health and the conditions that they're suffering. And with that, you'll be able to create, nudges to change our habits, to live healthier, fulfilling lives. And so that ends my talk for today. Hopefully this has been informational. To field any questions you have at this time.
Hey, Michael, thank you so much for that. That was awesome. So while we wait for questions to come in, I don't think you mentioned where people can connect with you offline or online, offline, online.
Yeah, so happy to connect with anyone. Our website is www.getspect, so GETSPECT.com, and then and then you can send me an email, just michael@getspect.com. Happy to chat.
Awesome. Are you LinkedIn, Twitter, neither, both?
Yeah, all of the above. I'm LinkedIn. I don't know what's the best way to share that information. out
Yeah,
there right
I'm. If people I just want people can go look for you. There's not a way for us to do it here, or maybe they can drop a link. But so I have a question for you. This is something that this in particular in the field that y'all are playing in, something that I find quite fascinating because my wife just finished her master's in Braille, so she's a Braille teacher, and all summer I learned about the retina, and it's just fascinating. That muscle. I think she told me some crazy statistic about like I can't remember what it is right now, but I'll definitely connect with you offline about it. But yeah, I think this area is such a maybe overlooked, underserved, and I think when you were going through the optometrist, when I used to go to the optometrist,
optometrist. Yes.
so I hated that machine that blew the air. I would hate like I even today. I know they don't do it. Last time I went a couple months ago, I was like, "Yeah, dude, I don't have to do that machine." She's like, "Oh, we don't do that anymore." I was like, "Oh, okay." I just remember as a kid growing up, like I hate it going. I hate touching my eye. Anything that has to do with the eyes. That's why I haven't done LASIK yet. But so I think it's really interesting how much science and technology is able to help us advance. And I know blindness is a big thing, not only in the U.S. but other parts of the world. So the opportunity, technology, and innovation in your space.
Yeah, 2023. Great question. Actually, I just came back from a conference earlier this week called HLTH or Health, and a lot of conversation around like how do we leverage technology to to provide better care. And kind of where I see my predictions are is, especially in the US where we're spending a crazy percentage of our GDP on healthcare, this is not scalable and this is not sustainable. And so there's a lot of very interesting companies out there that are innovating in many different spaces, beyond eye care, on workflow and payments and automation to make the overall industry more efficient. I think, with the pandemic, we've just been bogged down, right? I was like, one of my family members just had to go to the hospital for for outpatient surgery, but in the past where you can just show up and get your surgery done, now they need to do a COVID test. They're wearing a lot more protection and PPE, and so there's a lot more procedures that have been put in, and as a result, our costs of healthcare are going up. And so this is where where technology can really shine and decrease physician burnout, decrease clinician burnout, is by enabling them to really focus. It comes back to what I was saying earlier, right? This is how do we allow our physicians and our experts to practice at the top of their license, right? And able to do what they were trained to do, and not ask them to go and fill up mountains of paperwork. Right. Today, a lot of your physicians, even your family doctor, physicians, like they'll visit with the patient and then they need to go back to their office and spend 25 minutes, 30 minutes filling out a lot of paperwork, documentation on what they asked you, what they talked about. And that's just not efficient. And no one's happy doing that.
Yeah, no, I agree with you 100%. At the end of the day, you don't go to school for, 5, 10. My best friend just graduated as an anesthesiologist. He's been in school for like 12 plus years. I'm just like, y'all don't go to school for all that time, to just go fill out paperwork. You should be able to do what you do because you are at the highest level. And I think there's ways with technology to make that more efficient and seamless for them to stop doing all this busy work. Because I feel like most of the time that's what bogs most of us down is all this redundant busy work that could be outsourced to a technology or a software. So thank you for spending time with us today. Any last parting words you have? I don't think we have any questions that have come in yet. We do have a little bit of extra time if you want to hang out. Otherwise, being Dimitri up, who's the CTO of Glorium Technologies, to end. But any last parting words for our audience?
No, I think this has been, really great time. Thanks for having us. All great speakers today. I certainly learned a lot, just listening to others, I'm excited. As you said, I'm excited to see where healthcare goes and how we can really leverage technology. It seems to have a lot of exciting technology that people are working on that we've heard about these past few days. And I'm sure, in 5 years from now, the healthcare we receive will be very different than the healthcare we receive today.
Yeah, that's exciting for sure. I completely agree with you. Well, I hope you have a great day and stay safe and healthy.
Awesome. Thank you very much. Thanks for having us.
Okay, no problem. All right, guys. Well, we are heading into our last speaker. I am figuring out he's running a little late, so I will stick around. I'm not sure if anyone has any questions. I'd love to get your feedback as far as what you thought about who were your favorite speakers, what were your favorite topics. Love to answer any questions, but I will be back in 2 minutes to check in. But thank you so much for tuning in. I really grateful for everyone. Have you been here both days or have you just tuned in today? I hope you got a lot of insight and valuable things that you can take back. And one thing that I always highly encourage everyone as someone that hosts startup events across the country is just, don't be afraid to reach out. I saw a few LinkedIn requests come in from, I'm assuming, people in the audience. I'm looking forward to connecting with y'all and, seeing and hearing what y'all are working on. But, I highly encourage you that, to connect with all these speakers. I would say 99% of the time that they usually accept. It's very rare. So, you never know. Just like Andre did with me. He randomly DM'd me back in January and asked me if I wanted to host an event. And now I've been hosting 6 events. So I'm extremely grateful for Glorium Technologies. I also want to give a huge shout out to all the sponsors that made this possible, and the people behind the scenes that, usually not get as much recognition. So to the mods, thank you for making this super seamless and fun and easy for me. I really appreciate y'all. But I really look forward to the next event. I'm not sure if don't have a date on the next one or when the next one will be. So whether I'm there or y'all have another host, thank you all so much for tuning in these last 24 hours. I will be back in a few minutes to let y'all know the last status of our last speaker, Dimitri. Thank you. What's up, everybody? Thank you for sticking around. Unfortunately, Dimitri won't be able to join us today, and wanted to inform you. So we will be ending the summit. Thank you again for everyone that showed up. Really awesome 2 days. I learned so much. Really excited about the future of health IT and just some of the innovation and technology. So if you are working on an early stage startup or a product or whatever it is, reach out to me. Love to be a resource for you. Any way I can help, guide you, connect you with people, let me know. But my name is Javy Martinez. You can find me on Twitter, LinkedIn at JavyD on Twitter or JavyD Martinez on LinkedIn. And we definitely hope to have you back soon for another one of these awesome summits by Glorium Technologies. Thank you, Glorium, Andre, Dimitri, the whole staff, and all our sponsors. Thank you, everybody. Stay safe and healthy and have a great day. Bye.